There's Jim Campbell.
Oh, yes. Oh, hi. How are
Hey,
you?
how are you?
Good. Well, as you can be, good as you can be in a pandemic.
Good afternoon, colleagues. The Senate Finance Committee is now in session, and we have a very interesting bill hearing today. Let me just go down the order of the bills so that you know what the agenda looks like. Our first bill will be 913, Senator McCray. Following him will be 542, Senator Eckhart. Then 481, Senator Carter. 499, Senator Lamb. 876, Senator Jackson. 507, myself. 502, Senator Carozza. 521, Senator Kramer. And finally, 461, our Vice Chair, Senator Feldman. And so we are going to start now with Senate Bill 913. We will be, all of our sponsors have whatever amount of time they need to frame the bill for us. And then their selection of a person who's the lead proponent, that person will have 5 minutes. And then everyone else will have 2.5 minutes. And so Senator McCray is here, and we'll start now with Senate Bill 913.
Thank you, Madam Chair and Mr. Vice Chair and members of the committee. For the record, Corey McCray, Senator for the 45th Legislative District, East and Northeast Baltimore City. I come to you today in reference to Senate Bill 913. Senate Bill 913 would help us as the state of Maryland implement the Heat and Eat program, which is a federal program, reimbursable program that serves dual purposes. One, to make sure that our folks have their SNAP benefit, to make sure that they have their utility benefits in reference to their heat. This is a partnership between a bridge in reference to our SNAP and our meat benefits that currently exist. In 2019, DHS has already done a report that shows that this will be benefiting over 30,000 plus families will be able to directly and bring extra federal resources to the state of Maryland. Madam Chair, I won't belabor the point because I saw that with the testimony that was submitted, it was over 20 some pieces in support, and it was no one unfavorable. So at this moment, I would just ask for a favorable report on Senate Bill 913, and then I would swing it over to Mr. Michael Wilson, who will be the leading proponent. Thank you, Madam Chair and Mr. Vice Chair.
Thank you. All right, Mr. Wilson.
Thank you, Madam Chair, and the Honorable Vice Chair and Senator McCray and members of the committee. My name is Michael J. Wilson. I'm the Director of Maryland Hunger Solutions, and we're here in strong support of S. Bill 913, which would implement the federal Heat and Eat bill. I've already submitted a written statement, and I've already submitted other documents. I'm not going to read my testimony. I'm going to summarize it quickly in 4 quick points. First, this bill has broad support. We've submitted a letter of support by more than 30 organizations around the state of Maryland, including the food banks, the Maryland Food Bank, Capital Area Food Bank, faith-based groups that are Catholic, Jewish, Episcopal, Baptist, many others, as well as Fair Farms Maryland, Homeless Persons Representation Project, and many others. The NAACP state conference signed on after we were able to submit this, so there's broad support. Secondly, this bill is rather simple. As Senator McCray said, we want to make sure that people who are eligible for the SNAP program and people who are eligible for low-income energy assistance get additional SNAP benefits. We're not making people eligible who are not eligible. These are folks who are already eligible. This is an existing federal program. If Maryland implements it, there are Maryland residents who will get additional SNAP benefits. And we know the biggest problem for SNAP participants is that they don't have enough income and they don't have enough benefits, and they usually run out of benefits before the end of the month. The third point is it's somewhat complicated in that you have to do the matching It'll take staff time. It'll take computer work for the agency to do this. I know because I've talked to the agency in the past when the secretary and the executive director of the department said to us, we just can't figure out how to do this. But we know that they can figure it out. We know they've got new updated computer systems. And we also know they have new leadership. And so the fourth thing I would mention is that we also submitted testimony from Louise Hayes, who's with Community Legal Services of Philadelphia, talking about how it was done in Pennsylvania, our neighboring state, how they did it. And we've also submitted a memorandum from the then acting operations director in the department in Pennsylvania, Lourdes Padilla, who of course is now secretary here in Maryland. So we know she has expertise, that it's been done in our neighboring state, that it's been done in DC and Delaware. And we want Maryland residents to also be able to get additional SNAP benefits, bring additional federal dollars into the state of Maryland. I think the only challenge here now is I suspect there'll be support for this. I'm willing to answer any questions any members have, but this is a win-win for Maryland. And we're hopeful that that you, Senate, and the legislature will help us take this step forward. Thank you very much.
Okay, thank you very much. Let me ask you a question. I know SNAP benefits are really critical to a lot of people. And to hear you tell us, and the sponsor has also told us that some people in your jurisdiction, and I guess in other parts of the state, can be eligible for more SNAP benefits than they're getting. Since somebody in our committee has to take this bill to the floor, it won't be one of you guys who know the most about it. Tell me, what is the difference in the SNAP benefits that are available to people and that they're getting now, and what more they could get, and what separates them from anybody else, just so we are better able to handle the bill when we go to the floor.
Right. So I will tell you, and as an organization that actually signs people up for SNAP, doing your SNAP application is a little bit like doing your own taxes. For some people, that's really easy, and for some people, that's complicated. And so the answer to your question is, in every situation, your benefits are determined by your household size, your household income, and your household expenses. And the simplest way to answer your question is by using this energy benefit. Some people will therefore get additional benefits because it wasn't calculated before. We want to do the best and most accurate calculation to make sure that people get the maximum benefits.
Okay, so in other words, the base SNAP has been limited to what, food?
You can only buy your benefit for food, that's correct, but it's
Okay,
based on—
and now you can add energy in, and you want us to pass legislation that would help in what way to make sure these people can get this energy benefit that they otherwise would miss?
Right. So let me rephrase this, because I think your question is a good one. I want to make sure the answer is accurate.
Mm-hmm.
It's based on your household income, expenses, and size. We want to make sure that the expenses portion covers the entire utility benefit. And that's what's missing in some cases now. We want to get an accurate reflection of their expenses. And that expense may include an energy benefit. And that's what's missing in some cases.
Okay, thank you very much. Are there other questions? Senator Augustine.
Thank you, Madam Chair. Mr. Wilson, it's always good to see you, and always thank you for your advocacy. I just want you to be able to respond to the letter of information where the Department of Human Services was saying that they may have to set aside $8 million that would be people who are exclusively recipients of the Maryland Energy Assistance Program. Would you share with me what they're saying and what your thoughts are on that? I mean, just so that we have a good answer for that.
So I haven't seen this letter, so I'm afraid it's going to be hard for me to respond. Are they saying they're setting aside $8 million in state dollars?
They're saying that they would set aside the funds and then it may impact the factoring of the MEAP benefits, that they would set, the LIHEAP and the MEHIP funds.
Yeah.
Because it would be matching with your SNAP funds. And so they're saying you would have to set those ones aside, and or that the people who would be getting the SNAP funds, in other words, there's no additional MEAP money.
Right.
Right. We know it's like more SNAP money, not additional MEAP money. And so that they're suggesting that it may lower how much a person who, only qualifies for the MEAP might be able to receive. Does that make sense?
So I think what they're referencing is the fact that they're going to have to do the matching here. And they're not talking about additional dollars. So I will tell you, some states have allocated additional dollars, which has brought in more federal benefits for them. That's not what we're advocating in this case. But what I think what the state is saying, and once again, I have not seen the letter, is that they're going to have to make sure that the allocation that exists in the MEAP program is there in order to match with the federal SNAP benefits. And to be clear, this all happens in one agency. Both the MEAP dollars and the SNAP dollars are allocated by the State Department of Human Services. So it's within their jurisdiction to do that matching.
Good, thank you.
Okay, that's important to hear. And we're going to Senator Benson next, but it was people from that same department that handled it who raised the issue that caused some people to wonder, how does it really work together? Okay, Senator Benson.
Yeah, thank you very much. Thank you, Mr. Wilson, for your advocacy for the people who really are the little folks who can't speak for themselves. Is there a lot of paperwork involved in getting people into your program, or do they have to have certain credentials in order to get into the program? Or if a person comes off of the street and needs to eat, is that available?
Right. So it sounds like you're asking about people's ability to get SNAP benefits, particularly in the time of the pandemic, because all the local departments.
What's the difference between the two programs that we're talking about here?
So these are both programs that are administered by the Department of Human Services, the SNAP program, which I know you're familiar with.
Yes.
And the MEAP program is the Maryland Energy Assistance Program, which is also administered by the Department of Human Services. And both of those applications are done by the State Department of Human Services.
So they have to come through, it comes through you through the Department of Human Services.
Not through us. I mean, we're a small nonprofit here in Maryland, but we do help the state do SNAP application assistance. If people need energy assistance, we would refer them to the state because the state would do that application. So we can do the applications for SNAP. I think the question you're asking, and I could be wrong, so please let me know, is how complicated is it? How hard is it? And I think it's harder in a pandemic. You can't just walk into the local Department of Social Services.
That's what I'm after.
You gotta call a toll-free number and try to get to people, and that is complicated and that is challenging. So I wish it were easier, but the goal of this bill is to take the existing populations in those programs, not expanding it. I think you and I would like to expand it if we have that opportunity. But right now, what we're going to try to do is take the existing populations of SNAP beneficiaries and MEAP beneficiaries and make sure they're getting their maximum SNAP benefit.
Thank you.
Okay, thank you. Okay, we're going next to Vanessa Pierre. Is Miss Pierre here? Okay, I think I see her. You gotta just unmute yourself. Can you unmute yourself?
All right, there we go. Can you hear me?
Yes.
All right. Thank you for the opportunity to come before you today. My name is Vanessa Pierre, and I'm a single mother to 3 beautiful children, resident and food activist in Montgomery County. I serve on multiple boards and councils who also fight food insecurity. However, I come to you today on behalf of everyday people in my community working hard to keep their families afloat. While 2020 was the year most families were hit the hardest, I'd like to talk to you about 2019. 2019 was one of the hardest years of my life. Money was tight and there just wasn't enough of anything to go around. I was working full-time during the day and took a job at night. My kids never saw me, and I was mentally and physically drained. I applied and received SNAP benefits during this time, but because of my income, it couldn't last past a week. I was faced constantly with tough decisions I never thought I'd have to make, chief among them lights or lunch. I was fortunate enough to be enrolled in the Energy Assistance Program as well to help me pay for my utility bills, and these two programs together saved my family. It's not because the lights were on and our fridge was full, it was because it set me free from the turmoil of not being able to provide the basic needs for my family, and allowed me the mental space to make a plan to get back on our feet. That is what I'm asking you today. Give the community who needs this program the most a chance to come up from underwater and get back on their feet. The 2016 study by the Maryland Department of Human Resources estimated that 32,000 Marylanders could receive an additional $59 in SNAP benefits. When I think back to that time in our lives, I think about what that small amount could have done for our family. And after some research, I found it could buy fresh fruit, a week of breakfast, 3 dinners, and lunch. It may not seem like much at all, but would have made all the difference to my family at that time. In 2020, I have been with community partners before dawn, preparing to distribute food to a line of people that never seems to end. I've watched my colleagues turn away families when the food ran out, rain or shine, they stepped up, and I urge you to do the same. Be these families yes in a sea of no's and not yet. 15 other states and DC have passed this program and said yes to its residents. They decided to be the bridge between an already established federal program and its residents, and we should be no different. Passing Bill 913 will say to families like mine, yes, we see you, yes, we stand with you, and yes, we are here to help. Because we sow what we will reap. Food is local, and what we put into our families, our veterans, our seniors, and our disabled in terms of spending power will be given back to us. If there ever was a time to say yes to our families, our veterans, and our seniors, it is now. Thank you.
Thank you very much. Are there any questions for this witness? Okay. We're going next to Kaylee Schmitz.
Thank you, Chair Kelly, members of the Finance Committee for allowing me to speak today. My name is Callie Schmitz. I'm Director of Communications and Partner Engagement with the Maryland Center on Economic Policy. We are a nonpartisan, nonprofit research organization, and we believe that all Marylanders should be able to achieve their full potential in a healthy economy that offers a widely shared and rising standard of living. The SNAP program is a vital support for our economy, and taking the step to expand it by joining it with the Heat and Eat program would bring us closer to that vision of broadly shared prosperity. As you heard from Ms. Pierre and Mr. Wilson, there are tremendous benefits for this bill for SNAP recipients. I just want to make a few brief points about the broader economic benefits of this proposal. First, if you pass this bill, the additional federal Heat and Eat dollars will generate new economic activity in Maryland because recipients will immediately spend it at farmers markets, grocers, restaurants, and other local retailers. So we would argue that despite the fiscal note says it has a neutral impact, we would argue that it has a positive impact on small businesses rather than neutral. In fact, there's research that indicates that every new SNAP dollar increases economic activity by as much as $1.50. Second, low-income Marylanders will continue to experience the negative effects of the current economic crisis long after the public health emergency is over. Implementing Heat and Eat is one way to help them weather the storm's long tail. And finally, I just want to note that because of the disproportionate economic impact of both COVID-19 and past policy decisions on Black, Brown, and female Marylanders, any policy that targets aid to low-income households will reduce racial, gender, and economic inequality. So the Maryland Center on Economic Policy therefore urges a favorable report on Senate Bill 913.
Thank you. Are there any questions for this witness? Okay, if not, then that ends the. Okay, I think we left somebody else. James Campbell, AARP. Oh, that's Jim Campbell who used to be in the House. Okay, hi, Jim. Okay. You're muted, Jim. You gotta unmute. Jim, can you unmute yourself?
Got it now. Sorry.
Okay. In fact, we used to be in the same district.
Yep. Let me just, we're here to support Senate Bill 913. We want to applaud the co-sponsors, sponsor Senator Corey McCroy, Mary Washington, and Senator Lamb for sponsoring this very important legislation. And I think many of the points I was going to cover have already been mentioned. So I just want to talk about, we're here because of the need, and we're supporting the hunger solutions. And as a pandemic began last spring, Maryland Hunger Solution reported to us that SNAP applications increased by 600%. As of last June, 800,000 Marylanders were enrolled in SNAP, an increase of 14% over the previous year. In Baltimore City, where I live, more than a quarter of the households are enrolled in SNAP. So SNAP's a very, very important program. And there was a recent study presented to us by the FRAC Food Research and Action Committee that reported that Maryland has the nation's 7th highest food insecurity rate among people 50 and over, and the 8th highest food insecurity rate among those 60 and over. So we're really concerned about this issue as it's worsened in the pandemic. The SNAP program has shown to be effective in reducing food insecurity among older adults who have to choose between food, housing, medical costs, and utilities. Participation in SNAP by older Americans who are less likely to give up their medicine for food has been linked to reduced hospital and nursing home admissions, resulting in millions of dollars in taxpayer savings. So we think it's a very important program with a lot of cost benefits for taxpayers, and we're supporting Senate Bill 913. So thank you. I know you have a busy schedule today, and thank you for this opportunity. I appreciate it.
Thank you. Do we have any questions for this witness? Thanks so much to all of you for testifying. And that ends the hearing on Senate Bill 913. Thank you. Okay. We're going to move next to Senate Bill 542, Senator Eckhart. And okay.
Thank you very much, Madam Chair Kelly and Vice Chair Feldman and members of the Senate Finance Committee. I'm here today with an old familiar bill that came before you last year, and it essentially would allow those employees, nurses who work in our state facilities, like our state psychiatric facilities and other long-term care facilities, to work 3 12-hour shifts. Currently, a full-time worker would work for a 40-hour shift, and this has been considered an alternative to that, in that they would work the 3 12 hours, which equals 36 hours, but they would be paid for 40. This is a common staffing practice in many, many facilities. It has been for years. Believe it or not, when I worked at Eastern Shore Hospital before 2000, when I retired, we had implemented 312s as a recruitment tool to bring in additional staff. This is a measure that came before you last year in an attempt to increase recruitment and decrease overtime. It did not pass due to the COVID situation. And the governor then instituted Chapter 13 and 14 of 2020, which was the COVID-19 Public Health Emergency Protection Act of 2020, which authorized this alternate work week. That is set to expire this year, and that's why we would like to see this piece of legislation introduced, passed, so that we could go ahead and begin to implement that in the state facilities. So I think everybody's been supportive of this, the department, the unions, and this will be a great tool moving forward. So thank you very much for the opportunity to present to you, and I look forward to the favorable passage of this initiative.
Thank you very much. Are there any questions of the sponsor? If not, let's see. There were 2 people listed, but I'm not sure they have oral testimony. Herbert Shack.
Good afternoon, Chair Kelly. Thank you. My name's Heather Scheck. I am with the Maryland Department of Health, the Deputy Director of Governmental Affairs. Would you like me to continue with my testimony? Okay.
Yes, we have 2.5 minutes. Yeah.
Sure, thank you. As Senator Eckhart stated, the department is here in favor of Senate Bill 542. It's an important recruitment tool for the department, especially during the pandemic. You know, now more than ever, we recognize the importance of not only recruiting healthcare employees, but also retaining the ones that we currently employ. And this, it's considered an alternate or an alternative schedule just because it's a little different, or it is different than the typical state employee schedule. But I think it's important to recognize, and Senator Eckhart stated it very eloquently, that this is the traditional and this is the normal schedule in the private healthcare industry. Many nurses are familiar and work within this schedule. And so this will be a really important tool within the department's toolbox of recruiting and retaining our current employees. We did start this based on last year's emergency legislation in 2 of our facilities, and there's been tremendous participation and feedback. The employees really seem to like it. And I think my colleague, Jennifer McMahon, will speak a little bit more about the details. And I think one thing that's important to note is that the intent of this bill is not to replace current schedules. It's an option. So if someone does not want to participate, they don't have to. And I do know that Ms. Rose Wirtz from AFT, she testified in support of this bill on the House side. She had some technical difficulties signing up today. But I think, and the senator hit on this, that MDH came together with both AFT, AFSCME, and we all came to an agreement. I believe there are some amendments on the House side. I'm not sure if they made it into this into this version of the bill, but they're all agreed upon. I would consider them as friendly amendments, and with that, the department would respectfully request a favorable amendment on Senate Bill 542 with the amendments that were introduced in the House side. Thank you.
Thank you. Are there any questions? All right, if not, then we're going to, let's see, to Jennifer McMahon.
Senator Kelly.
Oh, yes. You have a question?
Yes, I just want to ask Senator Eckhart.
Sure.
Why couldn't this be, why does this have to come before the legislature? Why couldn't this be worked out with the hospital administrators or the unions? Why is this before our committee?
I think because it has to be done legislatively, because the hours are already in the law, and that's why we would have to modify the law to make that adjustment. Does it
have to do with the law, with the hours?
Yes. Yes, and that's the issue. Yeah.
Okay, thank you very much.
For you.
Okay, good question, good answer. Okay, Jennifer McMahon.
Good afternoon, Madam Chair, members of the committee. For the record, my name is Jennifer McMahon. I'm the Human Resources Director for the Maryland Department of Health. I thank you for this time today. This bill is important to us because, as I think Heather said, it becomes another toolbox another tool in our toolbox to attract and hire registered nurses to our various facilities. It continues to be very difficult, and we run into challenges when we compete with the private sector who can offer these 36-hour work weeks. We were able to work with AFT during fiscal year 2020 to come to an MOU agreement that permitted this arrangement. And then the emergency legislation that was stated from last year, Senate Bill 1080, allowed us to begin a small pilot of this program, and we found really, really good success so far. We decided to pilot in Finan Center out in Western Maryland and also the Western Maryland Hospital Center. We chose those two hospitals because they have existing 12-hour shifts already, so it wouldn't be a huge change. The big change is that our current folks who are working 12-hour shifts work 3 12-hour shifts, plus then they have to make up that remaining 4 hours of that work week, either by working the 4 hours in the week, picking up an 8-hour shift somewhere else in the 2-week pay period, or they have to use their own leave to be able to cover that. So in this situation, they would work 36 hours and get paid for 40. As I think Heather mentioned before, that we've had really good success. We have posted these positions in both of these hospitals. When we posted, we did 2 positions. We posted the 36-hour work week position, and we posted our regular 40-hour per week shift because we wanted to be able to gauge what the response rate between the two would be. And we've gotten about 3 times as many applications for the 36-hour work week as we have for our regular work week. In addition, we've got Finan's a little bit farther along in this pilot than Western Maryland, but they gave the option to their existing staff who were working 12 hours, whether or not they wanted to shift to the 36-hour work week as well. And all 18 of them took that opportunity to move over. So it was popular both with employees on the outside as well as our existing employees. And we were actually able to rehire a former employee who had left before. So we're seeing really good success. This is not something that we plan on kind of taking over our agency with. This is not going to become the new norm. It's something that would be tested for a while, phased in slowly, and used really only in those situations or those units where it would be appropriate. We do want to continue giving both opportunities to our employees. So I am happy to answer any questions. I appreciate your time this afternoon, and we do request a favorable response. It would be fantastic. Thank you.
Sure. Are there any questions of this witness? Okay, they gave us a nice, clear description, and so there aren't any questions. Thank you very much.
Thank you.
We're going next to Senate Bill 481, Senator Carter. Senator Carter's aide is going to be testifying because she's in a voting session, and we do want senators to be able to vote, don't we? So Dan Zanchattin, well, I might be murdering his name, but I hope he recognizes my attempt, and he will present for Senator Carter, Senate Bill 481.
Good afternoon, Madam Chair, members of the committee. My name is Daniel Zanchattin. I am Senator Carter's legislative director, and I sincerely apologize. I bring her apologies. For some reason, I don't have video. There we go. I send her apologies for not being available because she is in a voting session right now and she has to be there. I appreciate your indulgence, if I may.
Sure.
An explosion rocked Northwest Baltimore. It destroyed 3 homes, injured 7 people, killed 2 residents. People were out of their houses for months on end. The ensuing investigation couldn't rule out that it was improper or incomplete installation of the new HVAC system that was the cause for the gas leak. During the months after the explosion, it was extraordinarily difficult for neighbors and elected officials to learn any details of the investigation from state and local fire officials. In the aftermath of the crisis, the public rightfully expected answers from their elected officials and their government. The process must be standardized. We had lots of people who were asking us what happened, what was going on, and we couldn't tell them. And people were understandably on edge, nervous that something like that, because they didn't know exactly what happened, something like this could happen again. And there was another explosion, as we know, in that same neighborhood in District 41 this last year as well. This bill would simply require that the state fire marshal report periodically to the Public Service Commission on investigations relating to fires or explosions. The first report would take about 90 days, would be within 90 days, and then every 90 days after the investigation began until it's concluded. The update report wouldn't include much other than just the status of the investigation and the expected due date for when they think the investigation would be completed. Based on all this, based on just our residents needed some answers and some solace, and they couldn't get it. It was very frustrating for everybody involved. Based on this, I urge the committee to vote favorably on Senate Bill 481 to allow more transparency during a very stressful time. Thank you.
Thank you. Are there any questions for this witness? I would just like to say that I had a lot of concerns. That was my old district when I was with Jim Campbell and Sandy Rosenberg in the old 41st legislative district. And I worried that until now, we've only had BGE's word for what happened or didn't happen, but whether they had any liability for what occurred or not, and not anybody else needing to weigh in who would be a third person not involved or with nothing to gain or to lose. But this is very important, and I'm glad that you're here.
Madam Chair,
Senator Benson.
is this a local bill? Is this just for
Well, no, it would impact
statewide?
Anywhere
This
where
is
there would
statewide.
be a major problem of this type. What the Public Service Commission would have to do to get the updates regularly.
Thank you.
Waiting
all.
for months or years, not knowing what was going on. Is there any other question for this witness? Okay, thank you very much. We're going next to Sandra Johnson, who has 5 minutes, and she's from the Falstaff Improvement Association.
Okay, can you hear me?
Yes.
I'm having some technical difficulties, so you may not be able to see me. I will try not to be too redundant with Dan, but I'm speaking on behalf of the residents of the Falstaff community, which is in the far northwest corner, close to Pikesville, and we support Senate Bill 481. On August the 10th, 2020, there was a well-publicized explosion in the Falstaff community that killed 2 residents and seriously injured 7. 3 homes were destroyed, a 4th was demolished, and countless residents on Labyrinth and Nadine roads were badly damaged. Some of the residents of the affected area had to leave their homes and go and live in hotels. The last one I heard about didn't go back to her home until January the 1st, 2021. There may be others that I don't know of who still have not been able to return. Immediately following the explosion, I started to get questions from residents who wanted to know what had caused the explosion. I'm the president of the Falstaff Improvement Association, and even my house, which was about 4 blocks away, was shaken. Residents in the area, many of whom's houses were shaken, were concerned that whatever had triggered this horrible event could happen again in other parts of our community and other communities in and around Falstaff. I continued to get questions on the cause of the explosion, and I continued to raise inquiries with representatives from the offices of the president of the city council, the mayor's office, the state delegates for the area, and the fire department. The answer from all these sources from August through December was the same. The investigation was still ongoing, and they would keep me posted. Finally, on January the 11th, 2021, I received a notice from the new mayor's office of a press release planned on the update of the fatal August explosion for the next day, January the 12th. 5 months was far too long to wait for an answer from an official source to such a serious question. At our December meeting, residents were threatening to go to the press, and I honestly could not tell them that they were wrong. The 90-day reporting requirements established in the Senate Bill 401 are far more acceptable. And I might add, I believe this was mentioned by Dan also, while we were waiting for an answer, there was an explosion just south of us in the Edgecombe Circle area. So this added to the anxiety that everyone was feeling. As the president of the False Staff Improvement Association, I can see how our community can benefit from this bill. Even if the report was not final, an interim report from an official source is better than nothing. And I thank you for your consideration.
Thank you very much. Are there any questions for this good witness? I'll just say that I share your concerns. I used to be president of the False Staff PTA when the False Staff was a middle school.
Yes.
Yeah. And so it really worried me to think that my old neighbors were going through all of this, and we don't know what has happened, except that BGE has reported. You know, if you're the one that bears responsibility for the service in the area as the major entity, you ought not be the one to investigate yourself and report out that you have no responsibility, that there's no liability to anybody. And that's kind of what has happened. But at least we ought to get these interim reports and not have to wait all those months. And so I appreciate your being here.
Thank you.
Okay, let's go to Brian Gerasi.
Good morning, Madam Chair. I don't know if you can see me or not yet. The camera doesn't seem to be working.
Well, we can hear you.
Let's try this.
We do hear you.
Okay. So good afternoon again. Brian Geraci, I'm the Maryland State Fire Marshal. Thank you for the time. We're not here in opposition of the Senate Bill 481. With regards to the explosion to Baltimore City, the Office of the State Fire Marshal has no authority in the Baltimore City. If you read the public safety article, the Office of the State Fire Marshal's responsibility is only for state-owned properties and buildings in the city of Baltimore. Baltimore City Fire Department was the lead investigating agency on that explosion, and they're the lead that will provide the information. So the issues that have been presented today are all with the issues with the Baltimore City Fire Department, not with my agency. If this bill was to pass, I would have to provide to the Public Service Commission 800 to 1,000 investigations that I do each year to provide them information on all those investigations. That's a little bit unreasonable, I think, and I don't think we would be able to do that. You know, even though there's cases that we're in, and even as the Public Service Commission only looks at those cases where there's a public utility involved, and the jurisdictions that I'm located in, the only really public utilities that I have are electric companies. I don't have any gas companies that are supplying natural gas to any of the counties that I'm responsible for. Also, the Public Service Commission is on the scene of that incident as well. They're conducting a parallel investigation as well as the local officials. So the information that the Public Service Commission is gathering, they're gathering the same information that the fire investigators are gathering as well. So it makes no sense for me to report to the Public Service Commission. I'm already reporting to the State Fire Prevention Commission. And I will tell you that my office did not receive any inquiries about that explosion whatsoever, because they would have come to me. And so I don't think the bill is necessary. The Public Service Commission doesn't believe it's necessary. They don't want these reports. They don't know what to do with the reports. And I would ask for an unfavorable report because it's just unreasonable for us to do this.
Let me ask you a question.
Yes, ma'am.
Absolutely correct in your assessment of whether you bear responsibility in your agency. But could you have recommended an amendment? You're dealing with members of the local community who were impacted. They aren't quite sure who it is that does have the responsibility and the ability to give information. You could have offered an amendment to suggest where they might go rather than to say it's not I. Don't you think?
Well, I think they do know, and they went to the right people. It rests solely on the Baltimore City Fire Department. They were the lead investigating agency. They have a fire marshal in the city. They went to them and they couldn't get the information from them. So, you know, then you take it up the chain and go to the mayor's office. You know, that's not my responsibility to do that. I mean, if they had called me, that's what I would have told them to do. You need to call the Baltimore City Fire Marshal's office. They're the lead agency.
It sounds so bad to hear public officials simply say, it's not I, and instead of helping people, you could have held their hands or come to a meeting, you are their fire marshal, to tell them why you don't have responsibility and who might have responsibility and what they might do to get the information. If it were your community, you'd be concerned, don't you think?
Well, absolutely. And if I was invited to a meeting, I'd been more than happy to attend the meeting. But I wasn't. And, you know, again.
Well, I'm just going to suggest that even your tone suggests you're talking down to fellow taxpayers and homeowners and people who've been traumatized and they aren't quite sure to whom to put the question, but they need information. They're afraid even living in their homes. Thanks so much. Okay, that's the end of the testimony, I believe, on that particular bill. Okay. We're going next to Senator Lamb, Senate Bill 499, prohibitions on vending machine sales of drugs and medicines repeal. Okay, Senator Lamb. Senator, you have all the time you need to lay out your bill, and then your lead proponent will have 5 minutes. That's Robin Elliott, and the other witnesses will have 2.5 minutes each. Thank you.
Great, thank you, Madam Chairman. Appreciate the time. And members of the committee, this might be my first time this session in finance. So it's a pleasure to be here on Senate Bill 499. For the record, Clarence Lamb, Senator in District 12. This bill is a very straightforward, simple bill. It seeks to repeal an outdated prohibition on the sale of over-the-counter drugs in vending machines and align the state of Maryland with nearly every other state by allowing the sale of over-the-counter drugs via these vending machines. So just to be clear, we're only talking about over-the-counter drugs. These over-the-counter medications are drugs that the FDA has deemed safe and effective for use by the general public without seeking treatment from a health professional, obviously. This includes things like Tylenol that we've all used, Pepto-Bismol, and even some nicotine replacement products like gums and patches. Because of how safe these drugs are, the FDA has decided that they can be sold virtually anywhere, grocery stores, convenience stores, gas stations, including vending machines. However, Maryland specifically prohibits sale of these over-the-counter products in vending machines. And with its prohibition on vending machine sale of over-the-counter drugs, Maryland is actually more restrictive on these over-the-counter cessation products and other types of products in vending machines that would otherwise sold through these mechanisms. So the current law is old, and we're not sure why this hasn't been updated so far, but it really serves as an unnecessary burden on businesses looking to expand their services and serves as an unnecessary barrier to accessing medication in communities without a pharmacy. So by passing this bill, we're hoping that will allow businesses to expand access to over-the-counter medications in neighborhoods without pharmacies and support local pharmacies by allowing them to provide 24-hour service, even if they don't have the staff to be open all of the time. So with that, let me wrap and hand it over to other members of the panel. It's a pretty straightforward bill. Urge a favorable report.
Thank you. Senator Reedy has the question.
Thank you, Madam Chair. Senator Lamb, you and I have occasionally been on, or at times on opposite sides of different issues. I think this is a really good bill. And I guess I was curious if you could elaborate on, do we know why, was there a good reason that if this was put into place? I was trying to read through the fiscal note history. This has been in place for a long time. Was there some sort of demonstrable reason why we did this however many years ago, forbid this kind of sale?
I'm not sure. I think it's been in place for a really, really, really long time. And I think that's why it's hard to get at the legislative history of this. It probably predates almost everyone. I think there was probably, it made sense maybe when it was a different era when, there may be concerns about the safety of some of these drugs and people may just have been less knowledgeable, like patients on their own were less knowledgeable about some of these medications. And so there was some concern that somebody could just go on their own and buy it without like reading the label or understanding. We now have seen that FDA is really, strict about, and we have experts from FDA on this panel with Dr. Wood about, reviewing this and monitoring these drugs for safety and ensuring that those drugs that are designated over the counter really fit this classification. So I think, it's in a way, many ways outdated. And I think it just hasn't been updated to kind of modern standards. And I think does speak to an access issue, as you kind of pointed out too, that, not every place has a pharmacy. And so at least for them to be able to get some basic over-the-counter medications, it seems like a reasonable way to do this.
Well, because I will tell you, there have been times where you've got a headache or you have a tooth bothering you. And if you're not near a store, figuring out how to, like if you're in an airport or something and you don't want to pay, $38 for a bottle of Tylenol,
right.
I would like to have a convenience store available. So, have a dispensary available. I think it's a pretty good idea. I know we always have to look for potential downsides and everything, but to me, I think it's a great idea. And you make a great point about the access issue. So thank you very much.
And we've probably all been in situations where, we have a headache or we're not feeling well. And we're like roaming around the office to ask like, hey, do you have Tylenol? Do you have Advil? Do you have something that I could borrow for this, right? So this could be a solution to that too, as you point out.
Thank you. Are there other questions? Okay, we're going to Senator Klossmeyer, who has a question, followed by Senator Bidle.
Yes, thank you, Madam Chair. Senator Lamb, does this include meal prophylaxis? Would that be in the bill?
It would include anything that's deemed over the counter or designated over the counter by FDA. So if their safety profile of that drug is sufficient to receive that over the counter designation, then I didn't hear exactly what medication you're talking about. But
I'm talking about male condoms.
Oh, and I would assume yes, although I think you can buy male condoms in vending machines already, but I would assume yes. I think condoms are regulated by FDA as a device, and so if they can be sold over condoms obviously can, then that would be fine, I assume, under this bill.
Okay, well, because I can just see that if it's not in the bill now and then somebody tries to do it, then you'll be back. We'll have to keep adding things, so.
Yeah, I think condoms are already allowed.
You think?
I'm pretty certain condoms are allowed. I think there are other members of the panel can also speak to that too, but yes,
okay.
they're.
Okay.
Okay. All right, Senator Bidle.
Thank you, Madam Chair. I think my question was answered. It's any over-the-counter drugs that are currently available in a drugstore.
Right.
Thank you.
Okay. Thank you very much for the questions and for the answers. Okay, we're going next to Robin Elliott.
Yeah. So good afternoon. I am here today just representing myself. I worked on a research project during my COVID time with the National Health Law Program. And I personally reviewed 44 state laws and colleagues reviewed the others. But we looked at all 50 states in the District of Columbia. We had what we call a triple review because we do intend to publish the results. And so the number of 46 other states allow this, that number came from that research. Those 46 states, all these OTC products are permitted. And they have been very safe. We identified no issues whatsoever. And the bill is being supported by a number of clinical groups, including the Maryland Nurses Association, the physician assistants. You'll notice healthcare for the homeless is on the list, and that makes perfect sense. I think it just makes sense for everybody. To answer some of the specific questions, Senator Klossmeyer, condoms are actually already allowed. There was an exception created in the 1980s because of the AIDS health crisis. And it was actually Delegate Pauline Menace's bill. For those of you who might remember her, she put in that bill and created that exception. So they've been allowed. So this is very safe. The other states that don't allow it are Georgia, Connecticut, and Oklahoma. And to Senator Reedy's question, we looked, this law is so old, even the Department of Legislative Services, the library couldn't help us. There was no bill file. We don't really know why the restriction was passed. And similar in the other states that we looked at, it's also a really old law. And I suspect Senator Lamb is right, just based on some outdated assumptions. So I did speak to the last state that had a repeal was Maine. That was just a couple years ago. I talked to the lead legislative sponsor. She said their emphasis is on allowing these small rural pharmacies who can't be open 24 hours to put a vending machine outside. And so it's really, it could be a pharmacy, it could be a community center. I personally will lobby for one in the lounge where lobbyists hang out. We need an aspirin too. So it could be anywhere, and it's really a way to just bring medication to people where they are and where it's convenient. Thank you so much.
Thank you. Are there other questions for this witness? Okay, if not, we're going to Susan Wood.
Hello. Thank you very much, Madam Chair and members of the committee. I want to thank you for allowing me to testify on this proposed legislation. My name is Susan Wood. I'm on the faculty at George Washington University School of Public Health, where I'm a professor of health policy and management. And back in the early 2000s, for 5 years, I was assistant commissioner at the Food and Drug Administration and directed the Office of Women's Health there. So I'm here today to give the perspective of FDA policy on prescription and non-prescription drugs and their marketing. So as you all no doubt know, FDA regulates medicines to make sure that if they're being marketed in the United States, and there are two different systems, there are two tiers. There's prescription medications and non-prescription medications. And those are often called over-the-counter drugs. And there's some really key differences. All of these medications have to be proven safe and effective and meet the same very high standard for that. But prescription medications have to have this learned intermediary, whether it's a prescriber of some sort, and that's determined by the state. But non-prescription medications, after passing the safety and efficacy standard, also have to be, the condition has to be self-diagnosed. You have to be able to self-treat and self-manage it. And so you can think of headaches, indigestion, some infections, and once, if it meets that standard, then it can go over the counter after additional studies are done. And those have to be submitted and approved to the FDA that show that the label can be understood by the consumer and that they can use the product themselves based solely on the label without that learned intermediary helping them out. And so that's how a product becomes over the counter. And that labeling is really important. And there's a standardized drug facts label on there to make sure it's clear and makes the product usable and safe by a consumer without a prescriber. Once it's approved, there's really no limitation on where it can be sold. It can be sold in a variety of non-pharmacy settings. And there's nothing in FDA statute or regulation that says you can't use vending machines. And indeed, in the FDA compliance policy guidance, that position is actually stated, and it indicates that as long as the products meet the labeling requirements, that FDA does not restrict the use of vending machines for dispensing over-the-counter medications. So based on the information about FDA requirements for safety and efficacy, the appropriateness of over-the-counter medications to be sold in vending machines, and the fact that Maryland is one of just a very small handful of states that do not allow this, I strongly support this bill and urge a favorable report to improve access for Maryland consumers.
Thank you. Are there any questions of this witness? Okay, and our final witness is Ashley Black from the Public Justice Center.
Yes. Good afternoon, Chair, Vice Chair, and members of the committee. My name is Ashley Black. I'm the lead attorney for the Health Rights Project at the Public Justice Center. We strongly support this bill. It's a bill that's really about timely and convenient access to healthcare for consumers. We can ensure that Marylanders don't have to travel or wait for a pharmacy to open to get access to what they need. And this bill takes into consideration that many people don't live near a 24-hour pharmacy. And in Maryland, there are many pharmacy deserts in communities with higher populations of low-income individuals and people of color. Because of the pandemic, many people who are sick or have health complications that are managed with physician-recommended over-the-counter medications are trying to avoid public spaces. And so this bill not only supports social distancing, but there's also research that shows that vending machines stocked with over-the-counter medications actually increase patient adherence to medication, and as a result can actually lower healthcare costs because it's reducing return visits to doctors' offices and hospital admissions. Finally, these vending machines empower communities to negotiate affordable prices with manufacturers and negotiating what's stocked in their vending machines so that the service is responsive to the community's need and the average income level of that community. It's time for Maryland to join the rest of the country in eliminating inequities in pharmacy access. And for those reasons, we support this bill and we thank you and urge a favorable report from this committee.
Thank you. Are there any questions for this witness? Okay, that ends the testimony then on this bill. Thanks so very much. Okay. All right. We're going to move Senator Jackson's bill last. Okay. Senator Jackson is in a voting session and will be moved to the end of the calendar. And I have a bill coming up, and our vice chair is in.
Okay, Senator Kelly, the next bill, Senate Bill 507. That's your bill, Senator, Madam Chair. So you've got unlimited time to present Senate Bill 507.
Thank you very much. Senate Bill 507 is titled Assisted Living Programs. And it's here because of a plethora of concerns regarding significant but unreported and undocumented cases of assisted living residents whose Social Security checks and our government pensions are under the control of the owners and or administrators of assisted living programs that provide room, board, and medication management to the elderly and or disabled. Many Marylanders depend upon assisted living owners, managers, and our staff for management and use of their Social Security funds and or their other pensions, to which Maryland assisted living residents are beneficiaries. Senate Bill 507 requires that on or before June 1st of each year, each assisted living program that was appointed as a representative payee for residents of the assisted living facility at any point during the reporting period shall report to the Division of Consumer Protection on the use of Social Security benefits of residents of the assisted living program facility during the immediately preceding year. And other federal, state, or local government funds for residents of the assisted living program facility also during the immediate preceding year. Assisted living program does not include a nursing home as defined in the Health General article. It doesn't include a state facility as defined in section 1801 of this article. A program licensed by the department under Title VII or Title X. It doesn't include a hospice care program regulated by the department under Subtitle IX. So it doesn't include services provided by family members or services provided in an individual's own home, or a program certified by the Department of Human Resources under Title VI, subsection 5. When the Office of Healthcare Quality refers an allegation of an unfair, abusive, or deceptive trade practice by an assisted living program to the Office of the Inspector General, the office shall also concurrently refer the allegation to the Division of Consumer Protection and the Office of the Attorney General. Attached to my written testimony is an amendment that was accepted in the House cross file by the HGO committee, which will enhance the bill. And what that does is to notify the division of the appointment of an assisted living program as a residence representative payee at the request of the resident within a reasonable time after being made aware of the appointment. This same notification would go to the Inspector General within the department. This is a bill that's really about intervening and making public officials aware of, in some cases, the fact that many disabled and elderly people don't have family members or confidants and are not any longer themselves able to manage their funds, or in a few cases that we have found were actually forced by an assisted living program when they could no longer live on their own and they didn't have family to assist them and so on, to use the assisted living as the representative payee for their government funds. And the only funds that are involved here at this point in time would be the Social Security, pension, or any other federal, state, or local pension funds that are being managed for the person by the assisted living. We think that just shedding light on it, making the authorities aware of who is managing the people's funds, makes it easier for these people not to be taken advantage of. And also, if there is a problem, there are obviously many good people are managing assisted living programs and are going to do what is right and what is fair. But if there is a problem, then because this periodic notification is required, the government can check to be sure. And if there is a complaint that someone registers, the government is aware already because of the requirements of this bill of who it is at the assisted living entity that is requiring that the person use them or is offering out of the goodness of their hearts, in fact, to be used as the representative payee for that person's governmental funds. That's really what the bill does. And I hope you will agree with me that a lot of seniors who don't have family members and a lot of disabled persons who don't have confidants that are trusted, who can do this job, many of them can't do it for themselves, that the government is aware of who is and can periodically check to be sure that everything is in place and that no one is being taken advantage of. Thanks so much, and I hope you'll support the bill.
Okay, thank you, Madam Chair. Any questions for Chair Kelly on Senate Bill 507 before we go to her panel? Okay, seeing none, we're going to go, Madam Chair, your designated witness is Tammy Bresnahan from AARP. And Tammy, you're going to get 5 minutes as the designated proponent, okay?
Thank you, Vice Chair Feldman, and thanks Senator Kelly, the chairman of the Finance Committee, for sponsoring this bill and putting it in. I'm Tammy Bresnahan with AARP. We are one of the largest advocacy groups that represent Maryland seniors, people over 50 in the state of Maryland. Our owner, Ethel Percy Anders, founded AARP in the late 50s because she was a retired school teacher and she went to visit a former colleague who was living in deplorable conditions. She didn't have health care. She didn't have, much of a pension. And she said something that resonates with me. What we do for all. And I think when I think about the Maryland legislature and the advocacy work I do, we have to sometimes do what we do for all versus just, a few. And in this case, there are 1,600 assisted livings in Maryland alone, and 72% of those, are around 70%, have less than 9, people living in them. And of those, a lot of people turn over their Social Security payments to live in that assisted living. And I truly believe that assisted living is a very, very important part of the lifespan spectrum, especially for long-term care. But we can't use long-term care as a warehouse, drop our loved ones off or our neighbors off and forget about them. We must have oversight, and we must be willing to make the hard decisions about making sure that the money that they've earned their whole entire life is being spent appropriately. When we look at a representative payee, an important factor to remember by federal law, they cannot mingle the beneficiary's Social Security payments with other money or use it for others. The bank account into which the benefits are deposited should be fully owned by the beneficiary, with the payee listed as a financial agent. Some payees, generally those who do not live with the beneficiary, are not, like Senator Kelly, required to submit reports. But the people that are the payees that aren't their relatives, they do. AARP believes that governments and long-term services and support providers can implement various approaches like this to promote service quality and protect the rights of consumers. And that includes enforcement, strong ombudsman oversight, accreditation, and guaranteeing consumer rights. And I believe that this is what this bill does. You're going to hear from the Attorney General's office, and they will tell you a little bit about what the duties are. AARP also believes that states should, we applaud the efforts of Senator Kelly for bringing this bill forward and protecting Maryland's most vulnerable. We know she has concerns. We staffed a caregiving commission, a caregiving task force several years ago, and this resonated with us. It kept coming up over and over again, and I know she's been concerned about it, and I think it's time for the legislature to act. We truly ask you for a favorable report, on Senate Bill 507, Assisted Living Programs Reporting. Thank you.
Okay, thank you for your testimony, Ms. Bresnahan. Any questions for the witness? Okay, seeing none, we're going to go to the next witness, Pat O'Connor from the Attorney General's office.
Good afternoon.
I see there you get 2.5 minutes, okay?
Thank you. Good afternoon, Mr. Chairman, members of the committee. Chair Kelly, thank you so much for this bill. We support this bill and its reporting requirement because we believe it's a step in strengthening protections for our vulnerable adults who are residents in assisted living programs, where the programs are the representative payees and they are not properly spending the funds that Social Security gives to them on behalf of the resident. The funds are supposed to be used for essential needs, and that's legally required if that is violated, it is also a violation of the Maryland Consumer Protection Act. Reporting this information will allow some insight and transparency into how the physical and financial needs of our vulnerable residents are being met. The REP payees are specifically required to use the funds for residents' food, clothing, shelter, utilities, medical care and insurance, dental care, personal hygiene, and rehabilitation expenses. The REP payee programs may not spend the funds in a way that would leave the resident without necessary items or services such as housing, food, or medical care. Not use the residents' funds for their own personal expenses, and as Ms. Bresnahan stated, they may not commingle the residents' funds with their business account or in another person's account. The REP payee programs, like all other representative payees, are required to file an annual report with the Social Security Administration explaining how they use the funds. This bill would require them to report the same information to the Consumer Protection Division. And they must also report on whether other government funds have been received for the resident and then explain how they've been used. The division currently receives referrals of alleged unfair, abusive, or deceptive trade practices by assisted living programs from the Office of Healthcare Quality, or OHCQ. We did submit a clarifying amendment that would clarify the current method of making the referrals would continue, that they would be made separate from any other referrals that may be made to the Office of the Inspector General in the department. We urge the committee to give a favorable report with amendments on this bill. And again, thank you, Chair Kelly.
Okay, thank you, Ms. O'Connor, for your testimony. Any questions for Pat O'Connor from the AG's office? Okay, seeing none, we're going to go to the final witness on this bill, Ashley Black from the Public Justice Center. Ms. Black, I see you there. You've got 2.5 minutes.
Great, thank you so much. Again, Ashley Black from Public Justice Center. I'll be brief because I think that Chair Kelly and the witnesses before me did a beautiful job laying out the issues and what this bill does. We strongly support this bill as a common sense bill that recognizes that there is a conflict of interest when an assisted living program is appointed as the resident's beneficiary representative payee for Social Security. In most representative payee relationships, the payee is a family member, but in about 15% of cases, the payee is an organization or facility like an assisted living program. And this type of arrangement has the potential for abusive or coercive practices due to the financial interest at stake, especially where the resident is trying to leave the facility for another or transition back to the community. This bill would provide much needed oversight and protection from the Maryland Attorney General's office in preventing those beneficiaries whose representative payee is an assisted living program from being taken advantage of. And it also aligns very well with best practice recommendations. So we fully support it and we urge a favorable report.
Okay, thank you, Ms. Black, for your testimony. Any questions for the witness? Okay, seeing none, that concludes the bill hearing on Senate Bill 507. Madam Chair, I'll turn it back to you.
Thank you. We're going next to Senate Bill 502, Senator Carosa. Senator, you have all the time you need to explain your bill, and your lead proponent, Colby Ferguson, will have 5 minutes. Other persons speaking on the bill will have 2.5 minutes each.
Thank you, Madam Chair. This is Senator Mary Beth Carosa, representing District 38, and that's Worcester, Wycomico, and Somerset counties on the beautiful Eastern Shore. And I want to thank the Madam Chair, Vice Chair Feldman, and the members of the esteemed Finance Committee for this opportunity to present Senate Bill 502 and to request your support again. Senate Bill 502 simply clarifies that the current agriculture exemption to the Maryland Wage and Hour Law to include those employed at an agricultural stand, a retail farm or farmer's market that primarily sells agricultural products that the employer has produced. This is the same bill and in the same posture of the clarifying bill that was approved by this committee and by the Senate last year. And I just thought you would enjoy seeing a prop here, an apple to support our farmers markets and agricultural stands. Madam Chair, as way of background, Senate Bill 502 is one of the initiatives that was included in the bipartisan Senate Small Business Work Group's legislative package unveiled last session. The legislation was drafted after work group members, and that's chaired by Senator Katie Hester and co-chaired by Senator Chris West, after the work group members heard from their local farm bureaus and chambers of commerce who raised concerns that the agricultural exemption in the minimum wage law did not include agricultural stands and farmers markets. There was an assumption that they had been included, and it took many by surprise that we needed to do this small technical clarifying bill to include them. The current Maryland wage and hour agricultural exemption, as the committee knows, exempts those employed by an employer who is engaged in the processing of perishable food items, those employed in agriculture if the employer used no more than 500 agricultural worker days per quarter during the preceding year, and those engaged primarily in the range production of livestock employed as a hand harvest laborer or is paid on a piece rate basis. That's what the current ag exemption covers. My bill, Senate Bill 502, clarifies that the agricultural exemption in the current Maryland wage and hour law by including those employed at an agricultural stand, including a retail farmer or farmer's market, again, that primarily sells retail perishable or seasonable fresh fruits, vegetables, or horticultural commodities that the employer has produced. Senate Bill 502 is consistent with the original intent of the agricultural exemption to the minimum wage law. And this, all my bill does is simply clarifies that the exemption will include agricultural stands, retail farms, and farmer markets as narrowly defined in this bill. My panel today includes Colby Ferguson with the Maryland Farm Bureau, Michelle Wright, a Wycomico County farmer and owner of Wright's Market that many of you pass on your way to Ocean City, and Lisa Gaver, a tree farmer in Garrett County. I want to thank all the local Farm Bureau and Chambers of Commerce members who actually worked to identify the problem with the current exemption and helped us craft this very narrow targeted bill to clarify the agricultural exemption. In closing, Madam Chair and members, last session, when I presented this bill to this committee, I was humbled to be joined by former Senate President, Senator Mike Miller. And that day and his strong support will always be a highlight for me in serving in the Senate. At that time, Senator Miller told me that he assumed the agricultural exemption included those working at produce stands and farmers markets that primarily sells agricultural products that the employer has produced. My colleagues, that was pre-COVID. Now, in light of how hard COVID has hit our small family businesses across the state, and that's on top of how volatile farming is between the weather and commodity pricing on a national scale, market competition from commercial produce markets like grocers. Madam Chair and members, it's only fair to pass this narrow targeted bill to clarify that the ag exemption includes the agricultural stands and farmers markets in this narrowly defined bill. And I respectfully request a favorable report on Senate Bill 502 to provide this needed relief for our farm families. And I thank the committee for your support.
Thank you. Are there any questions of this witness? All right, we're going next then to Michelle Wright.
Colby Ferguson. Colby Ferguson is the
Oh, I'm sorry. No, I'm sorry. Colby Ferguson, and that is the person with the 5 minutes. Okay.
Thank you, Madam Chair, members of the committee. Colby Ferguson on behalf of Maryland Farm Bureau here again this year in support of a bill that is very narrowly focused. It's really a corrective bill that we honestly thought was addressed in that 11th hour of the bill that was passed several sessions ago. And after everything was reviewed and regulators looked and comptrollers looked, this narrow area of concern was not addressed in the bill previously. And so last year it came back, and we moved to try to get that addressed. And the Senate did move and pass it out. And as you guys know, 2 days after bill crossover, we shut down. So never got a chance to get the full process in the House. And so we're back again, kind of the third bite at the apple here to address this kind of a concern. And I really want to make sure I focus. I'm sure there's the people that are opposing this bill really are focusing on trying to make sure that everyone is paid the $15 an hour, and that we raise our living wage to a point where people can provide food for their family and and heat their houses and put their kids through school. But really, where this is really focusing on is, and you'll hear from the two individuals that are going to testify after me. But really, what this is like a job training opportunity. These positions are all temporary. They're seasonal type. When you look at a farmer's market, it's only open during the summer. You look at a retail farm that does like Christmas trees or pumpkin patches. These are very seasonal type positions that are maybe 2 weeks to 7 to 8 weeks in time frame. And quite frankly, these are the people that are being hired are kids that can drive, so they're 16 years old, but are still not in college or have a full-time job. And so these are individuals that work on a weekend, maybe can only work 1 or 2 days a week, and so they don't qualify for a job at McDonald's or at one of the other places that would require more permanent jobs. And so they're busy in school. They're in sports. And so this gives them an opportunity to put, and you'll hear about some of the things that some of these farmers are doing. And so really, we're really focusing on trying to shore that up, that those farmers really do more with less. And when we start talking about labor, we're talking that as well. So if we have a 33% increase in labor costs, they're going to have to do more with less, and that will be less employees. So I'll stop there and answer any questions that might be.
Are there any questions for this witness? Senator Reedy.
Thank you, Madam Chair, and Senator Caroz, thank you for bringing this important bill. It's an important bill for my community as well. Colby, could I ask you, I think it's sometimes hard for some people to understand that, like a farmer's market or a farm, a produce stand, we're talking a lot of times about essentially people pitching into almost a family business, even if it may not be their direct family. It's like the kid down the street that knows the farmer, or the 4-H, a couple of kids met through 4-H and are going to work at the stand, a little bit here and there. I mean, you hit on it some, but I think it's not the same as if, somebody's going to work for a small business for 15 hours a week even. I mean, can you talk a little bit about that?
Sure. I think you hit and I didn't elaborate on that, but also retired. These businesses are primarily open on the weekend. So you think about a farmer's market, it's open one day, it might be a Saturday, it might be a Monday. We're not talking about the workers that are working daily on the farm, that are picking the vegetables or are doing the crop work and all that. We're talking about the ones that go to the farm stands that are at the retail market, that are open only a couple days a week. And to try to find somebody to do that job for 6-7 weeks and only work 2 days a week is almost impossible to find somebody, because they're going to be looking for a full-time job, particularly that one that's looking for a living wage. And really what we're talking about is those individuals that possibly a first job ever, that they're looking to put on their resume for college applications, or they're trying to meet their National Honor Society requirements that are in high school, or a retired individual that doesn't want to just sit at home and loves being out in nature. And so that's really the focus of who who fill these jobs, and it's not a living wage. And honestly, those individuals that work on a farm that are there full time are paid well more than $15 an hour, because they just wouldn't work if that's all they got paid.
I just think it's important to know we're not talking, like you said, about somebody who's working in an orchard or something. I mean,
right.
Like a 40-hour week in an orchard, we're talking about, or even a 20-hour, week and helping with produce or whatever. This is like very temporary. Because sometimes when this issue has been talked about before, I almost feel like people get the sense of, oh, it's a farm worker exemption. No, that's not what it is. This is very narrowly crafted. So thank you for your comments and clearing that up.
Thank you.
Thank you. We're going next to Michelle Wright.
Good afternoon. Can you hear me okay?
Yes.
Okay. Again, good afternoon. My name is Michelle Wright, and I live in Wicomico County. I am the co-owner of a roadside farm market located on Route 50 in Mardella Springs, Maryland. Our family farms about 800 acres and we grow produce that we sell at our retail farm market. We grow corn and soybeans, and then we also grow chickens for Purdue Farms Incorporated. And the vast majority of what we sell at our market is fruit and vegetables that are grown on our farm, and it goes directly to the consumer or to our customers that visit our market. Being a seasonal business, we employ about 20 people depending on the time of the year. Their daily task includes stocking shelves, waiting on our customers, and the daily cleaning and sanitizing. Keep in mind that these people that we hire, this is typically their first job experience. We teach them lifelong skills that they will hopefully carry with them after they graduate from high school and then go on to college and hopefully maybe to a trade school. These young people don't have typically any prior job experience. And we find that or believe that this is an entry-level position. And for someone with no experience or really any job skills, we have a hard time just justifying the proposed wages that being asked to be paid. The financial impact is huge for us. With the last increase, it cost us about another additional $8,000 for those few months that we had to pay that. Looking at the next 2021 and 22, it's going to be about another additional $16,000. Just in the paychecks, not including the payroll taxes. And then as we operate, we typically operate on an operating loan. So we borrow throughout the year until the crops come in at the end of the year. So we'll be borrowing money and paying interest on that money that we're going to be using to pay the salaries. And just hope at the end of the year that we hopefully, weather will cooperate and we'll have the crops to cover our operating loan. Just to give you an example, when I compute that to produce, we would have to sell about 30,000 ears of corn over the next 2 years to cover that additional cost just for payroll. Business here on the Eastern Shore, we don't have a way of really increasing or forcing a large margin to absorb the cost of the wage increase. And with everything, we have to brainstorm and figure out ways to handle this. So we're looking at, do we need to hire or look for people that are older with more experience? Do we hire less people and add to our current workload to cover our shifts that we have? Do we increase the cost of food, the products that we currently sell? Or do we find creative ways to adjust our hours and just, need less people?
I hate to butt in, but your time has expired.
Okay.
Okay. Are there any questions for Ms. Wright? Okay, we're going next to Lisa Gaber. Is Lisa here? Okay, if not, then we'll go to Sally Daverick Fisher.
Good afternoon. Can you hear me?
Yes.
All right. Thank you, Madam Chair, members of the committee. My name is Sally Dworak Fisher, and I'm an attorney at the Public Justice Center, which is a nonprofit legal organization whose mission is pursuing systemic change to build a just society. Our workplace justice project protects and promotes humane working conditions through litigation and public policy. We are in strong opposition to SB 502 for 4 reasons. First, it undermines the purposes of our wage and hour law and further weakens the bedrock protections of that law. Second, the vague language of the bill creates a potentially dangerous loophole. Third, the bill is not necessary in light of existing exemptions and is particularly troubling in the midst of a pandemic. And finally, the bill would likely disproportionately hurt workers of color. Now, I don't have time to get into each of these, but our overarching concern is really the problem that is this bill would take Maryland in the wrong direction. As the General Assembly recognized when it passed the wage and hour law, the purpose of that law is to set the bare minimum wage standards in order to provide a maintenance level sufficient for the general well-being and health of all Marylanders, safeguard from unfair competition, increase employees' buying power, and decrease the need for workers to turn to public assistance as a result of low wages. This bill would carve out additional exemptions for certain businesses, depriving those employees of the bare minimum wages set in Maryland and undermining the purposes of the act. Particularly now, as Marylanders are struggling to put food on the table and pay the rent, eliminating their right to be paid what has been deemed to be the bare minimum permissible would be a step in the wrong direction. Our written testimony further details our objections to SB 502. And in my limited time remaining, I just want to clarify something in the fiscal note that I noticed. The fiscal note posits that these businesses would still be bound by the Federal Fair Labor Standards Act, but that's not necessarily true. If what we've heard today is true, that these are just primarily small family farms, the Fair Labor Standards Act does not necessarily apply. That federal law applies only to businesses with an annual sales volume over $500,000. In short, we oppose SB 502 and we urge an unfavorable report. Thank you.
Thank you. Are there any questions for this witness? Okay, thank you. We're going next to Brig Dumais.
Greetings, Madam Chair. My name is Bridge Dumais, and I'm a business organizer with Fight for 15. We strongly oppose this bill, which will gut the $15 an hour minimum wage. This committee and the majority of the legislature already agreed that $15 is needed because there's nowhere in the state anyone can get by with less. Compromises were already made that exempted far too many workers, including youth workers and agriculture workers. However, we agreed that the $15 an hour minimum wage should apply to retail workers. The definition of retail is, quote, the sale of goods to the public in relatively small quantities for use or consumption, end quote. So workers at farmers markets are and should continue to be classified as retail workers. Raising the minimum wage spurs much needed economic growth. Higher wages benefit businesses. Workers are customers. Raising wages empowers them to participate in the economy, thereby increasing demand for goods and services. Next, small businesses are at a competitive disadvantage when wages are low because their prices tend to be higher than large businesses, and workers will shop where they can afford. Third, raising wages saves businesses money. High turnover rates and low wage jobs mean businesses spend more on recruitment and training than they would be spending on retaining workers by paying them higher wages. Finally, raising wages leads to better customer service, fewer mistakes, and increased productivity. Excellent customer service is what causes patrons to be repeat customers, which brings steady revenues for businesses. Reducing errors and increasing productivity also save businesses money. Our minimum wage is not $15 yet, so efforts to erode the wage floor are disappointing. Adding insult to injury, the vast majority of workers that would be exempted if this bill passes are essential workers. Now is the time to pay them more, not fight to depress their wages. It's unfair to ask essential workers to do more while earning less. The economy is only as strong as the lowest paid worker, and SB 502 will leave more working families behind. When workers do well, the economy does well. It is that simple. So I urge the committee to issue an unfavorable report on SB 502. Thank you.
Thank you. Are there any questions of this witness? Okay, we're going next to Chuck Cook, the AFL-CIO.
Thank you, Madam Chair, members of the committee. I am Chuck Cook with the Maryland State and DC AFL-CIO, here to oppose SB 502. This committee, the General Assembly, worked for 4 years on Fight for 15, and there was a lot of give and take and compromise back and forth, and we have 14 exemptions in our Maryland wage and hour law, 4 of which apply directly to agriculture and food production. We don't believe that we should be finding new exemptions. If we're working on Maryland wage and hour law for minimum wage, we should be getting rid of exemptions, not expanding them. So let's just talk about on businesses directly. These are retail sales. Bridget made a really good point about it being a retail sales business, right? We have plenty of retail food outlets. They're grocery stores, right? They have to follow Maryland wage and hour law, right? They don't get to pay their businesses, or they don't get to pay their employees less than minimum wage. So we don't need to exempt retail workers, but based on where they actually work from Maryland wage and hour law, it would be creating a penalty to grocery stores for following Maryland wage and hour law. So the proponents have cited, you know, this is for younger workers, this is for older workers that are retired. Great, then we already have 2 exemptions in Maryland law right now. Under the age of 16, you don't pay minimum wage. From 16 to 18, you only pay a percentage of minimum wage. Over the age of 62 and employed for less than 25 hours a week, you don't pay minimum wage. So these exemptions already exist. And we don't need to create a system where we actually have retail businesses working against each other. And then last but not least is also the issue of subjectivity in the law. The senator had talked about, you know, being a technical fix, but the language in it is very subjective, right? Markets that primarily sells agricultural products. All right, who's doing the inspection to find out what primarily actually means on this? How are we determining that this is actually in compliance with the law? So not to make a bad joke out of it, this has a few holes in which you could drive a few produce trucks through. And that's one of our biggest problems with it too, that it's very hard to define and figure out who's going to be actually hit by this. And then on top of all of this, you know, we heard, you know, on top of COVID, we don't want to hurt small businesses. And I would say, well, on top of how hard COVID has hit workers, it would be unfair to pass any kind of new exemption that would allow employers to pay them less than the minimum wage. So with that, we respectfully ask that you find unfavorable on SB 502.
Thank you. Are there any questions for this witness? Okay, we're going next to Corey Johnson.
Sure, Madam Chair.
Is that a question?
Yes.
All right, Senator Benson has a question. So.
Yes, I want to just ask the sponsor of the bill, how much on an average is paid those workers at this present time? What's the hourly rate for those workers? How much are they paid?
Colby, I'll have
currently,
and if or Ms. Wright.
On an average.
We're currently paying them the minimum wage that the state requires us right now.
Which is how much is that?
$11.
Okay, thank you.
It actually just went up this year, but we're not open yet. So, but for last year.
Okay, thank you very much.
You're welcome.
Okay.
Madam Chair.
Now, yes.
I wondered if I could ask.
Wait a minute. Are you trying to answer that question?
No.
No, I was trying to ask the question.
All right, I can't go back again. Let me ask, is Corey Johnson here?
Yes, ma'am, Madam Chair.
Okay, all right, you're next. You have 2.5 minutes.
Greetings, Madam Chair, Mr. Vice Chair, members of the Finance Committee. My name is Corey Johnson, and I'm an attorney and the Senior Policy Research Analyst at the Job Opportunities Task Force. At JOTF, our mission is to provide employment opportunities to low-skill, low-wage workers. More particularly, we are committed to eliminating barriers to meaningful employment, one of the largest of which being the ability of workers to earn a livable wage, no matter the employment industry. We strongly oppose Senate Bill 502 specifically as it ensures the poverty of thousands of Marylanders. In 2019, we fought hard to change the minimum wage standards for the state of Maryland to reach $15 an hour by 2026. Currently, however, the minimum wage in Maryland sits at $11.75. Senate Bill 502 would eliminate the standard for even more members of the agricultural workforce. This includes farm stand workers, retail farm workers, and workers at farmers markets. Please keep in mind, as everyone has already stated, that there are already exclusions under Maryland wage and hour law. All individuals should have access to a livable wage, especially now during the pandemic. Those in favor have articulated that this is a catch-all provision to correct the exemptions of the original legislation, but those original exemptions were also problematic. All Maryland workers should be exempt from slave labor, no matter the season, the age, or the industry, whether it's a kid down the street working for a family business who wants some extra spending money, or an immigrant worker supporting her family of 5 in the midst of a pandemic. Everyone deserves to be paid the value of their labor. The People's Law Organization identified that the living wage in Montgomery County, Prince George's County, Howard County, Anne Arundel County, and Baltimore County and City is $14.42 an hour. Further, with the average household size of Maryland being 3 individuals, the MIT Living Wage Indicator indicates that a poverty wage for a family of 3 is $10.44 an hour. SB 502 would not only eliminate agricultural workers from the opportunity of making a livable wage, but it would essentially be a poverty sentence for all Marylanders working in that particular industry. Agricultural workers already make up Maryland's lowest paid workers. I believe they make $35,000 a year as reported by the MIT Living Wage Indicator. Despite agricultural workers being the largest commercial industry in the state of Maryland, employing about 350,000 people. Finally, SB 502 would increase the racial wealth gap that is already looming over Maryland's economy. The unemployment rate in Maryland is 3.3%, yet the Black unemployment rate is 6.1%, nearly triple that of white Marylanders, which is 2.3%. It goes without saying that people of color comprise a vast majority of racial demographics in agriculture. According to the U.S. Bureau of Labor Statistics, Black and Latino workers make up a combined total of 32% of agricultural workers, hindering these individuals from making a living wage. This racial effect would be similar to the effect of the 1935 Social Security Act that served as a racial stratification to wealth by excluding large portions of Black workers from receiving employment benefits to ensure the continued lack of wealth building in Black communities. For these reasons, we urge an unfavorable report of SB 502.
Thank you. Are there questions of this witness?
Senator Reedy and Senator Augustine.
All right, Senator Reedy and then Senator Augustine.
I had a question to the previous witness as well, but I would like to ask Ms. Johnson a question. So you're quoting statistic. Number one, I strongly disagree with characterizing a legitimate policy difference on paying people who work a few weekends a year at an agricultural stand with the Social Security Act of 1935. Hearing a lot of rhetoric here at this hearing, and it's like, all right, let's slow down a little bit. We're not talking about every agricultural worker, correct, in this bill. This bill does not refer to every agricultural worker. Is that, Ms. Johnson,
it refers to a specific type of agricultural worker, right? And I would not say that this is just rhetoric, but this was what supercharged the 1935 Social Security Act. I know, as both, not only as an attorney, but as a doctoral student at Morgan State University, that there are certain parameters that the 1935 SSA Act, that allowed for the exclusion of Black workers. And I think that that's the same.
I'm not defending the 1935 Social Security Act. I'm saying I don't think it has a lot of relevance with this. I think it's putting a tinge of something that I don't think we should put on what is a well-intentioned bill, whether you agree with the bill or not, is what I'm saying.
If I may, I believe that I understand what the intention might be. I guess my focus is on the disparate impact, right? So in saying that the disparate impact of communities of color would contribute overwhelmingly to the already racial wealth gap that's in Maryland, right? There's literally the Black unemployment rate, as I stated previously, is almost triple that of the white unemployment in Maryland. And Black workers make up over 32% of the agricultural workers in the state of Maryland. In saying that, I think that there is absolutely a correlation between them making up that workforce and the unemployment rate, right? We might stand on that issue, but yeah. I don't, however, think that they're completely irrelevant.
Okay, well, and I actually think it's a really interesting statistic, the 32%, which is good, I think, for all of us to know. Would you acknowledge that eliminating, these are jobs we're talking about in this bill that can just easily be basically eliminated. A farmer could just decide, I'll just tough it out and deal with having this stand without hardly anybody working there except maybe a couple family members. So those jobs just go away for someone who's somebody who's a young African-American, young white, young Hispanic, doesn't matter what color they are, but it could be anybody that has an opportunity. Sounds like 32% of agricultural workers. Again, we're talking about the whole industry, but I think, don't you think that if there's a job that could be, and this was sort of going to be my question to Mr. Cook, which, this can just apply for what I'm going to say, but these are jobs that can just go away. It's not the same as a supermarket where they're going to be, they're selling products and making enough to be able to afford to pay somebody a higher wage. These are stands that are selling apples for like, $2 a bag or whatever. I mean, I love shopping at these places, but it's a very inexpensive. It's to me, you're sort of, not to use another bad analogy, but it's like we're comparing apples and oranges here. These are jobs that could go away. These are opportunities that'll just go away because they're not. You said you wanted in your testimony. This is the thing that struck me. You said in your testimony that you want people to value everybody's labor has value. Totally agree. With an arbitrary $15 an hour wage that is not even set to market rates, we're not valuing labor. That's a larger philosophical. We're not doing an accurate value of labor. That's another philosophical argument. But I think I made my point. But I just want to ask the question of, I don't think we should be comparing a bill to try to add an exemption to the minimum wage law with the 1935 Social Security Act. And I do think it needs to be very clear. These are jobs that could just disappear. They could just, these little jobs for people to work a few hours a week, 7 or 8 weeks out of the year, or a couple months out of the year, they could just go away. So isn't that so? I'm supposed to ask a question. Isn't that so?
Well, Senator, I think that any job is a job that can go away, right? I think that in your analysis that it creates a hierarchy of employment, and I want to hesitate the committee away from doing that. Whether it's an attorney or a person that's selling selling, whatever product at a farmer's market, that job is important. And if you are employing someone else, then they should be paid. I guess that's the argument, right? It's not that the job can't be eliminated, because if the job could be eliminated because someone doesn't want to pay $11.75 to someone who is dedicating their time and energy to selling a product, and it's very beneficial to a business because who else would sell this product, right? I think that the overarching question is, if an individual is working, that they shouldn't be paid slave wages for their time and their energy. And if a person that is producing that agriculture chooses not to then hire that person, by all means.
Okay. All right. Senator Augustine had the other question.
Thank you, Madam Chair. My question actually is really for the sponsor. I'm looking at the legislation, and the way that I'm reading it, it just says somebody who's employed at an agricultural stand, retail farm, or a farmer's market that primarily sells the agricultural products. I don't see anywhere on here where there would be a limitation of time spent, like that a market, as I've seen, as I drive, through the Eastern Shore, where you have those stands that are always open. I mean, those are kind of ongoing concerns, which is a little bit different than the characterization of some kids or something like that. I mean, I don't see any distinction in there. Is there a distinction of some sort for that?
Thank you, Senator, for the question. And actually, I'm glad you asked it, because I wanted to go back to the section that you were reading, because what the last part of that clause, if you look on page 3 on line 10, it makes very clear that these are, that when we talk about a farmer's market that primarily sells agricultural products that the employer has produced. And that's why when the question was raised about all these loopholes and everything, that's very clear about the employer has produced. So I wanted to clarify that, and we put that in there to further narrow the bill. So I thank you for the question.
But you really didn't answer my question. So that's fine that the employer might produce the product on the farm. Let's say it's a farm, the farm is there, but the farm is a going concern selling whatever they sell. there's no limitation on their employees, the number of hours that the employee might work, but what you're asking is that that employee not get paid minimum wage. Is that correct?
I think this is what I would compare to, Senator, and thank you for the question, is, and I'll give a personal example. My family had the first fast food drive-through restaurant in Ocean City, and my parents probably gave hundreds of teenagers their first job. I can tell you that they would not have been able to hire those teenagers if they were forced to pay that minimum wage. The group that we're primarily talking about is those 16 to 18-year-olds that are either their first job or they're, it's part-time, or they're going to work 1 or 2 days a week. That's primarily the audience that we're capturing here. But I can tell you that we're trying to make it very clear that we're narrowing it to just that those products that the employer has produced, going back to that, and not opening it up to all these quote businesses that call themselves farmers markets. We specifically made it narrow to what the employer has produced.
That's not actually how I'm reading the bill. Let me ask you this. I mean, I understand what you're saying. I gotta just say this, Senator. The area that you represent, I believe that the poverty rate in the area that you represent is double digits. I mean, some of the county like 25%. How, I just don't understand how you wouldn't want those people to earn, all of them, to earn a higher wage to get them up to relieve some of the poverty in the area that you represent. I struggle with that. Can you tell me how you square that?
So I will point out that, first of all, Senator, there's currently an ag exemption for the minimum wage that was worked out, and that all we're trying to do is to include what was assumed was already in that ag exemption. And I think if you listen to Michelle Wright's testimony on who this would affect, and also, Madam Chair, there has been, our fourth witness has been trying to get in since the very beginning. I don't know if there were technical problems, but we did have another witness
I'm aware that she finally got her Zoom working, and I'll call her when you finish.
I appreciate that. So Senator, I appreciate the question, but it's one of the reasons why we had Mr. Ferguson and Ms. Wright kind of outline, what we're capturing with this very narrow clarification technical bill.
Thank you. Appreciate your answer.
Okay, if we could go to the other witness who wasn't able to get on before, Lisa Gaver.
Hi, can you hear me?
Yes.
Oh, thank you. I don't know what happened. It said I was unmuted on my screen. So good afternoon. My name is Lisa Gaver, and my husband Mike and I farm. We're actually in Frederick County, not Garrett County. And in addition, Mike and I are very proud that both of our children and their spouses returned to our farm after college and are working hard to keep that farm viable and to grow it. So keeping the next generation on the farm, not an easy thing to do at all today. Our farm is a diversified operation with traditional farm crops like corn, soybean, hay, and we have a small beef herd. We have 2 full-time year-round employees, and those 2 employees make a much higher rate than the $15 per hour rate and get considerable benefits. But we also offer a seasonal farm and agritourism business, which is open to the fall just during fall and during our Christmas tree season. And during fall, we hire just over 100 employees for our 7-week season. And during our tree season, for 2 to 3 weekends, we hire about 25 employees. The seasonal people I hire are 16 to 18 years of age. It's their first job in most cases. And we try to have them through 2 seasons, but we find that our best employees are the busiest people. They play sports, they're active in school clubs, they do well academically, but they're really from all walks of life. They're local, we pull from 3 regional schools. Most are looking for short-term resume building job experiences that they can continue their extracurriculum activities. Most can only work one day a weekend between their sports practices or a few hours after school. They want a job with community building experience for a college app or for National Honor Society applications, or just to get firsthand work experience. They don't have time to work many hours. On average, they work 8 to 10 hours a week, if that. And just to further say, we spend much of that 7 weeks of employment nurturing, training, teaching them job responsibility, respect, and they sure do learn people skills. Their jobs vary. They monitor activities, educational activities. They pull drinks through our food booth. They do cleaning, cashiering, restocking pumpkins, checking wristbands, bringing trees up, shaking and baling, that type of basic things. The cost of labor for us is a major issue in relation to our farms.
I'm sorry, your time is up. If you could wrap up.
Okay, thank you. I just want to say that our profit margins are slow, and just to make the point on, we are not a grocery store. Most of these jobs, a fast food restaurant or a grocery store, they would not hire someone for 4 hours a week and do the extensive training. We would have to cut.
We do have to move on.
Thank you very much. I apologize. I urge you to support it.
Okay. Senator Hershey, did you have a question?
Yeah, thank you, Madam Chair. Just quickly with Ms. Johnson, we talked about earlier the wage scale that we currently are at, and I heard that it was not random, that it was specifically determined. And if I look at where we are right now, it seems pretty random to me. 925, then it went to 1010, then 11, 1175, 1250, 1325, $14, $15. Sounds very random and not related at all to the value of the work performed. So, in giving this, we tend to allow, the advocates, the attorneys, students to come up with these policies or drive these policies with while ignoring the experiences of real business owners. So going back to what my colleague was, I think, getting to and asking before, isn't a job that pays $10 an hour better than a job that pays $0 an hour?
I guess that's a subjective question, right? Especially.
No, I think it's pretty okay.
I think that is a subjective question, and it's one of privilege for an individual who does not teeter that line. I think it's important to say that making a living wage and making under a living wage, whether you're making $0 an hour, which is impossible because one cannot make $0 an hour, that's slavery, or making $10 an hour, that's still below the living wage standard to actually functionally participate in society.
Well, we determined that rate wasn't really a functional rate. It was a very random rate, something we came up with 2 years ago, that just, went up a few quarters or, maybe a half a dollar every year. It wasn't really a functional rate. It wasn't tied to anything.
Well, I think that there's an actual national standard for how much is required in order to survive in today's economy that is partnered with the inflation rate, and it comes up with a number. And so in 2019, we worked with Maryland legislators to coordinate how much that money would be or what that would look like. In 2019, the committee as well as the legislature decided that using the levels of inflation that, $11.75 for 2021 and then raising it $1 or so every year was sustainable to get to $15 at 2026, which is far, far, far less than, we're not even including inflation come 2026, far less than what it would mean to have a livable wage in 2026.
Right. So we're nowhere near what you guys consider a livable wage, but we are in a position where individuals are getting offered jobs. So let me ask the question a little bit differently. If someone were to come up to you and ask your advice and say, hey, I've got an opportunity to work on a agricultural stand. They want to pay me $10 an hour, but you know what? I really like the people. They're very nice to me. I get to work outside. My schedule's a little bit flexible. I get to go to ball practice when I want and do a lot of things, but all they can afford is $10. Do you advise them to take the job or say, no, hold out for more, or better yet, you're better off not having a job at all?
Well, Senator Hershey, I think that your analysis is a mystification of the actual populations that actually are doing the agricultural work, right? So it seems
Ms. Johnson, I want to be clear. We're not talking about the agricultural work broadly. We're talking about a very narrow and specific group of agricultural farm stands. And you have two business owners that are here right now that have explained that business to you, not the broad agricultural industry, but a very, very specific line. So if you could refer your answer to that.
I understand that. And I don't think that, I understand that there's like the broader agricultural and then very specific. What I'm saying is that even if there's very specific, the racial makeup of the agricultural industry does not change, right? And so in saying that, even if we were to presuppose that there's a kid out there that wants to play in a ball game and also work at a farm stand and do all these other things, there's also equally a immigrant woman who has to provide for 5 children on the salary that she makes, or the money that she makes, or the hourly wages she makes at a stand, right? And so those.
No, I don't think we have to compare the two. I don't think that that's appropriate at all. I think if you've listened to the testimony of these business owners, they were very specific about the type of workers that come in and the type of workers that they look for, that have some flexibility that want to do that.
Let me butt in. I think we are getting into a debate, and I'm not sure that any of us is learning anything more at this point in time. We do have other people waiting for their bills to be heard, and we don't want to hear all that. I think the question.
Thank you very much, Madam Chair. Ms. Johnson, thank you as well, too.
Okay, thank you. Okay, we're going next to Senator.
I'm sorry, am I allowed to say anything, or am I?
Senator Jackson, no, to Senator Jackson, Senate Bill 876. Is the senator available? Or do you want to go to Kramer?
Madam Chair, I don't think the committee recognized that you left that bill and went to another bill.
Okay, we're moving to Senate Bill 876. We went backwards when he was supposed to be up because one of the witnesses hadn't arrived for the last one. We went back to accommodate that witness.
No, I just saw a number of the witnesses were still in the room for the last bill, so I just didn't think they clearly heard that we went to the next one.
Do you want to take Kramer?
Thank you.
Yes, we're going to take Kramer. All right, we'll take Senator Kramer. We'll come back to Senator Jackson. Senator Jackson was here earlier, but we went so long, I guess he had to go back to his committee. All right, Senator Kramer, Senate Bill 521, and you know the drill. Your lead proponent will get the 5 minutes, and that's Rachel Lamb, and your other witnesses will get the 2.5.
Committee, good afternoon. Ben Kramer introducing Senate Bill 521, which is a subject matter familiar to you all, so I'm not going to take up a tremendous amount of your time. This legislation would simply provide an opportunity for graduate assistants in the University of Maryland system to have the opportunity, if they so choose, and only if they choose, to be represented by a bargaining unit. And it would not require any of these students to be members of a bargaining unit, but if they chose to do so, they would be granted that opportunity. We have seen this bill on more than one occasion in the committee. Hope springs eternal. And, it is my ambition that we may actually have an opportunity to vote on the bill and allow democracy to do its thing. But you know, at the end of the day, I think that we have to recognize and appreciate that these graduate assistants are looking for nothing more than the opportunity, if they choose, to be represented by a bargaining unit. There are huge demands made of them. They put considerable amount of time, effort, and energy into what it is they do. This is not just about pay scale, but there are many other issues that are part of the subject matter here. And I know that in the last couple of years, we heard most recently this red herring that if somehow they were to become part of a bargaining unit, then it would affect their FICA and their withholding status. And the fact of the matter is that's nonsense. There are more than 30 public institutions now doing just this, universities across the country, and that has not reared its ugly head or manifested itself as an issue. And with that, I will turn it over to those people who are here and impacted by this issue.
Thank you very much. Okay, Rachel Lamb is the lead proponent, and you have 5 minutes.
Well, thank you so much, Senator Kramer, and good afternoon, Chair Kelly, Vice Chair Feldman, and other members of the committee. Thank you so much for the opportunity to testify before you today in strong support of Senate Bill 521. My name is Rachel Lamb, and I'm only about a month away from completing my PhD in geographical sciences at the University of Maryland, College Park. I'm also the former Vice President of Government Affairs for the university's graduate student government, and I am a longtime graduate assistant. As you know, since graduate students were banned from collective bargaining back in the early 2000s, there have been numerous student-led efforts to reverse it. This particular bill, which focuses explicitly on providing graduate students the right to collectively bargain if they so choose, has been before this committee for the last 3 years. And I have personally testified in front of this committee every one of those years, because I personally and strongly believe that graduate students should have this fundamental right and be provided beyond the scope of current meet and confer practice with a fuller suite of options for navigating existing power imbalances related to our employment as graduate assistants. Thousands of graduate employees, faculty, and campus groups across USM institutions have continuously expressed support for the legalization of collective bargaining rights. And this year, the University System of Maryland Student Council, which includes representation from schools across the system, has overwhelmingly passed a resolution of support for this bill. We know that COVID-19 has been challenging for so many of us in the state, and this does include graduate students. In fact, COVID-19 has only exacerbated the concerns brought before you year after year, and a clear and enforceable contract over the past year could have made a tangible difference in the lives of many graduate assistants. Before my colleagues share personal stories of impact with you today, I want to reiterate 3 high-level points. First, the effort has always been about more than money. Among other things, it's about addressing inequalities across the system, acknowledging the fundamental contributions of GAs to campus operations, and protecting vulnerable student workers who often have to navigate challenging power imbalances with supervisors and advisors. As one supporting point, you can actually see in our packet that the greatest number of petition signatories at College Park comes from the physics department, which actually offers some of the highest graduate assistant salaries on campus, let alone across the system. Any arguments about the potential implications of increasing GA salaries should just be handled in future negotiations, where we, as empowered graduate assistants, can make decisions about these trade-offs for ourselves. This conversation about cost should not preempt or distract from movement on this bill, which is all about securing our right to explore other legal mechanisms of negotiation as graduate employees. Second, we have no reason to believe that our tax status, explicitly the FICA exemption that graduate students enjoy, given our status as full-time students, would be threatened by the passage of this bill. As was previously mentioned by Senator Kramer, not a single one of the other R1 or Big Ten research institutions that have chosen to collectively bargain have lost this exemption. Yes, we are students. We are also graduate employees, and we are not the first system across this country to tackle and respect this unique joint status and identity. And in fact, the solutions advanced by many of our university peers across the country show us that we really can do better here. And finally, this bill enjoys broad support from graduate students across the system. It's not only an issue for graduate assistants at College Park. Here you can see in our letters of testimony and even on this witness panel that we have diverse institutional representation. Furthermore, as already mentioned, but worth reiterating again, the University System of Maryland Student Council has passed a resolution of support for this bill with no nay votes, emphasizing that this bill is about protecting graduate student workers across the system. While many student leaders have utilized Meet and Confer since it was established in 2012, persistent issues remain because the current system does not fundamentally address disproportionate power dynamics. This bill specifically gives us the right to consider other options as we continue to advocate for the holistic welfare of graduate workers. I urge you to vote in favor of this bill. There's no compelling reason why graduate assistants should be denied the right to collectively bargain if they so choose. Thank you.
Thank you. Are there any questions for this witness? I am going to make just a comment. I was a student graduate assistant at Purdue back in the early 70s when I had 3 kids, and it was really, really, really tough doing all of that at the same time. So I know what you go through. I know you're required to do the same work that a full professor in many cases would in terms of your classroom preparation and your evaluation of student work and your being professional in many ways without having a lot of what it takes to do the job well and to be healthy and mentally alert yourself. So I do understand. Okay, let me go to the next person who.
Madam Chair?
Yes. Senator Hershey.
I have a question, please, for
yes,
Ms. Lamb. It's been a while since I've been in a classroom. What does a graduate assistant do now?
Well, there's a wide range of tasks that a graduate assistant could be required to complete. We have 3 different classes of graduate assistants. Some are administrative assistants, some are teaching assistants. In some cases, those teaching assistants are actually the instructor of record. And there's also graduate research assistants. So, and many times they have leadership positions in whatever their role is. But those tasks vary quite a bit depending on who your supervisor is.
So 3 different classes of assistants. Are they all paid? How are they paid, or what are they paid? All differently or same, or what?
At the University of Maryland College Park, there is a minimum stipend that is established by the graduate school, and then different departments at their discretion can potentially increase that stipend level.
And are there other benefits that are provided as well?
Of course. So in addition to our stipend, we also benefit from health insurance, and we also get tuition remission, but we do have to pay our own student fees.
So one of the things you had mentioned is that making your own decision about the trade-offs. How would you make your own decisions if you were part of a collective bargaining group?
Yeah, well, for example, in the current Meet and Confer system, it is exactly how it sounds. You can meet with the administrators and you can relay your concerns, but that's where it potentially can end. There have been incremental, I think, adjustments that have been sensitive to some of the concerns that have been raised in those fora, but given the long track record of persisting problems, they're not being handled adequately or systemically. So specifically by addressing that power imbalance, for example, by choosing to form a collective bargaining unit, we can actually continue to leverage sort of the collective power that we have in numbers, I think, more effectively. But even having the right to potentially choose that, I think, alters the power imbalance, even if we don't.
Even though you have 3 different classes of graduate assistants and they all might have different benefits that they believe are important to them, you believe combining them all into one group and then having one set of benefits is best for all of the graduate assistants?
Well, certainly the specific design of any collective bargaining unit would need to go through multiple rounds of discussion and debate to make sure that any diverse interests are collectively included. So those are a lot of future conversations that we are prevented from having now simply because we don't enjoy the right to even engage them. So you certainly bring up there are a lot of things to consider, and I agree there are a lot of different dimensions to collective bargaining that we should consider.
All right,
but GAs across the system, as reflected in the letters of testimony, are showing similar issues. So they're not just reduced to those groups.
Okay, and I appreciate it. There were a lot of letters. And Madam Chair, my final question. If you had this granted, what would you ask for?
Well, I'm leaving the university because I'm finally graduating. But the reason why I'm here is because I want future graduate assistants to be able to enjoy these meaningful conversations about how they want to go about solving these problems outside of the current meet and confer system. So I think that this really will provide opportunities for these student leaders to have questions about what kind of mechanism they want to have in the future. So maybe that is collective bargaining and exploring all the diverse ways that that kind of unit could look. It could also be staying with the current system and just leveraging this right differently.
Okay. Thank you very much for your responses. Thank you, Madam Chair.
Thank you. In terms of experiences that I've had, when I was at Purdue, I actually taught 12 credit hours for just tuition and not fees. I paid the fees and they gave me tuition. And I really taught 4 different classes per semester of other graduate students, actually. I subsequently got a PhD at College Park where I wasn't a graduate assistant, but I had to do that. I worked full-time at Coppin, where I noticed that people who were graduate assistants there didn't even, in some cases, have a dedicated office or a desk or a dedicated phone. So for them to try to keep up with their students and to answer calls or to have a place to meet, they carried their coats and their books and their suitcases full of junk around campus with them. So student assistants, graduate assistants are treated as if they are expendable when they really have become a very integral part of what is absolutely necessary given the budgets that are set out for getting the job done and for teaching undergrads and in some cases other graduate assistants.
Madam Chair, I think you just made the case for why the committee should be voting on the bill this session. Thank you for that.
Okay, let me go to the next person, Michael McGee. Oh, you're muted.
Okay, there you go. All right. Good morning, Madam Chair, and also the Finance Committee. My name is Michael McGee, and I am looking for my, there you go. Sorry about that. So my name is Michael McGee, and I'm the graduate student, I'm a graduate, so I'm sorry, my PowerPoint just left me. Sorry about that. My name is Michael McGee, and I'm the Graduate Student Association President for Bowie State University, and I'm also a GA in the counseling department there as well. The purpose of my testimony today, each year I'm honored to provide a testimony on behalf of the graduate students at Bowie State University GA program. Over the last few years, I have been involved with advocating on behalf of collective bargaining and meet and confer for all the GAs in the Maryland universities. With the current administration at Bowie, we have built a strong relationship with the GAs, and we meet monthly to discuss expectations of the GAs and to hear the voices of the GAs surveys about the successes of the program, as well as the things that we need to improve to build a program cohesiveness. However, Bowie State graduates do not want to miss the opportunity to stand shoulder to shoulder with other Maryland universities who does not have the same dynamics or autonomy. Working to remain competitive in the current environment is difficult for a small liberal art university like ourselves. And when it comes to attracting students as we compete with private and more established universities in our neighboring communities like Washington, D.C. and Virginia. For us to remain competitive, we must use our social capital and Maryland systems to build a congruency between the universities. With one voice, we must speak for those who have no voice and commit to building a strategic plan of action that can be implemented on a longitudinal scale and embraced throughout the Maryland university system. What I do like about this bill is that it does give us choice. If our schools has the open dialogue and meets the expectations of the GA program, then passing this bill would not create a hardship on the university systems process. However, if the challenges with the university in this bill, if there are challenges with the university in the future, this bill will be a catalyst for improvement. Do we have concerns? Yes. Some of those holistic concerns are compensation, pay leave, and vacation time. Compensation is a hardship when it comes to the GA program. GAs makes around about $11.75 an hour, which is $3,760 a semester, which equates to about $7,520.
You got a few seconds.
Okay, a few seconds. To end this, while I do understand the complexities of resolving this concern, creating an instrument that gives the students a voice should be our concluding concern. I hope this testimony addresses the need to pass the bill and build a more fruitful long-term relationship between the university systems and the Maryland graduated assistants. Please speak favorably on this bill.
Thank you. Are there any questions for this witness? Okay, we're going to Liberty Deffenbaugh.
Thank you, Madam Chair. It is my honor to be speaking on behalf of Bowie State University as well. I have been a graduate assistant for 3 semesters, and I have another 2 to go before I'm able to graduate. Each semester, just like you said, Madam Chair, we are increasingly expendable and treated as such. Noted that we are contractual employees with often late contracts, incorrect or unforeseen issues that we don't have control over. It can take up to 90 hours of work to cover just our fees alone. And with a cap of 20 hours per week, that takes about 5 weeks of work for fees alone, not including the rising cost of living in the state of Maryland, our textbooks, things like that. So we absolutely need a culture shift, one where we can afford the education in which we are provided that is listed as free, but often is not. We also need communication that's clear and consistent. I was taken off of my contract last semester and told that I would be teaching on campus without my previous notification or consent when they didn't get enough volunteers to be teaching assistants on campus during COVID. Thankfully, I have a boss and a supervisor that fought for me, but this shouldn't have had to be the case. With collective bargaining, I would have been protected from having my contract pulled and changed, with a pay rate change, with a supervision and location change. The collective bargaining gives us the opportunity to have a seat at the table for decisions that are made that directly impact us. As educated persons, I'm sure you can understand our desires to really be as independent as possible. And we're not looking for a handout. I just want to be very clear about that. We're looking for a hand up. Collective bargaining is not something that you're voting on to give us at our institutions, but it's taking away our inability to have it. We're asking to be able to advocate for ourselves rather than rely on the good intentions of people who are more often concerned about the bottom line than the quality of our work. We are educated adult professionals, some of which are working on master's degrees, doctoral degrees. Some of us have several degrees at our disposal already. And so why would we want to deny educated persons a right to advocate for themselves? Often it feels like we're being tossed scraps and being told to be grateful for anything at all. And while I do want to be clear that some of us have professors and supervisors that will go to bat for us. It creates more of a power inequity where we have to rely on the same persons that are our advisors, who are professors and who really shape our educational careers.
Okay, thanks so much. Senator Vidal has a question for you.
Thank you, Madam Chair. And Ms. Liberty, thank you for your testimony. I've not ever taught in a graduate program, so I don't know what this process is.
Sure.
Do you negotiate, like when you're invited to become a fellow or master's degree, trying to work on your degree, are you negotiating an agreement, how many hours you work, how many classes you'll teach, or, what's the process for how you create your contract?
Thank you for your question. So when we apply for the position, we can apply for either a teaching assistant at my institution. We can apply to be a teaching assistant, a research assistant, or we're just kind of placed between one of the two. We have no control over whether we work over 20 hours. In fact, we were told at a meeting recently that if we wanted to be helpful to any professors that needed a little bit more help, then we were more than welcome to do that. We just would not be paid, and to ask for it would be a violation of our contract. So it is encouraged that we be available. And I find myself now basically on call. I work throughout the week. I track my time and do over 15 hours on meetings alone. But anything over 20 hours, we are just not paid for.
So the contract that you agree to when you're first
yes
hired, or I guess the word is hired, or you first come,
yes,
isn't enforced very strictly. It's like as needed.
So we are told that we can bill up to 20 hours per week. Ours is that we work 20 hours a week. So every week we submit a time card that says 20 hours. We don't have any control whether we're able to work more than that. I believe collective bargaining would give us the ability to do so.
If you refuse to do more than 20 hours, what would happen?
I believe that it would negatively impact my relationships with the professors that have asked me to upload their entire course loads on Blackboard when they're struggling. I recently had an experience where I tried to enforce my own boundaries and autonomy because my contract was set for January 25th, and she called me all throughout January to upload her class on Blackboard. And when I went to my supervisor, who's always been very gracious with me and my boundaries and my time, and recognizing that these are times that I'm not being paid, she told him that I was complaining. So it creates a very strong power inequity. And I am fearful that it has created a negative relationship between that professor and I. And if I'm being honest, I worry about having her again.
Thank you for your comments.
Thank you.
Okay, we're going next to Autumn Perky.
Thank you for the opportunity to speak to you today, Madam Chair and committee members. My name is Autumn Perky, and I am a second-year PhD student in government and politics at the University of Maryland, College Park. I come to you today and ask for your support in state personnel collective bargaining. While all graduate students, employees have different and diverse needs, I want to help contextualize the broader implications of collective bargaining for the lives and well-being of graduate students, employees in the state of Maryland. Again, this is nothing more than the opportunity, but the potential opportunities that open up due to this are substantial. I moved here in 2019, and the opportunity to receive a PhD allowed me to relocate myself and my children from a situation involving domestic violence and economic oppression. Coming to Maryland and relying on my PhD stipend to support myself, my then 3-year-old son, and my 5-year-old daughter was extremely difficult. I applied for what was called the Maryland Child Care Subsidy and is now the Maryland Child Care Scholarship Program. There was a lot of back and forth between myself and the decision makers on whether or not I qualified to receive the subsidy. Due to my research assistantship not having set working hours, that was viewed as not being qualified as a working position, and I was ultimately denied the subsidy. I was on a wait list for Head Start, so I also applied for Head Start. And ultimately, my first year in a PhD program, I paid $12,000 in childcare for 10 months while making $17,500 on a 9.5-month stipend. So as you can imagine, very economically poor, and I I relied a lot on department lunches so I could have food. Collective bargaining could potentially allow for us in the future to negotiate items in our contract, such as childcare subsidies. And part of our contract, we're also not allowed to work outside the university. So that's something to keep in mind, that part of what we sign on to is that we can't receive work outside. So there's not much I could do about that. So things are moving towards a more equitable solution on childcare options. I'm working with the university currently to alleviate some of that, but situations for graduate student parents are difficult while being defined as students rather than employees. For instance, we are ineligible for FMLA leave. So I imagine how important you guys can think of that right now. So what this means is that if a graduate student decides to have a child while in graduate school, they're given a maximum of 6 weeks paternal accommodation. If both parents are graduate students at the University of Maryland, the 6 weeks is split between them. Given that it takes a woman 5 weeks minimum to heal from a normal birth and at least 6 weeks from a cesarean section, this is concerning. And I think about the broader implication as what happens if something goes wrong? What happens if that child is born early? What happens if they have health issues and they need their parents? And then another additional aspect of this is, while not everyone here may be a parent, everyone has family. So the Family Medical Leave Act is designed to allow for the care of family in cases of unfortunate circumstances like we are seeing during the pandemic. While the
I hate to butt in, but your time is expired.
Okay, thank you, ma'am. Sorry.
Okay. Are there any questions for this witness? Okay. We're going next to Joanne Bauman.
Thank you very much, Madam Chair. And good afternoon, members of the committee. My name is Dr. Joanne Bauman. I'm the Senior Vice Chancellor for Academic and Student Affairs at the University System of Maryland. The USM has about 6,000 graduate students, including teaching, research, and administrative assistants, as you've heard, who are all first and foremost students earning advanced degrees in their chosen field. We currently have a policy that has 3 or 4 points that I would like to make. First, there are due process protections and grievance rights, including this meet and confer process you've heard referred to, that has the right to engage a labor representative to represent the graduate students in discussion with campus representatives if they so chose. No group has so chosen. Participation in shared governance process is a very important point, and statements of university expectations, as you've heard, regarding duties and time commitments are a part of this. In addition to the monetary stipends, I want everybody to understand that most GAs or trainees receive a tuition-free education, fully subsidized healthcare, and stipend increases each year of their contract. The current law and policy in place, as the meet and confer process and the shared governance process, provide graduate assistants with many of the perceived benefits that we believe collective bargaining might offer. We don't like to hear these stories. It hurts us to hear individual stories like some of the ones you've heard. But you also must know that the role of the graduate assistant and the role with their mentor is very complicated. We believe that choosing to create a union to collectively bargain will change that relationship, decrease the flexibility that many of our graduate students and assistants need, and with the current shared governance processes that will in fact be changed as well. We believe these would work to the detriment of the graduate students as a group. We therefore urge an unfavorable report of Senate Bill 521. And I'd like to tell you that I have with me today Dr. Steve Fetter, who's the Dean of the Graduate School at College Park. And I also have Ms. Carolyn Skolnick and Mr. Patrick Hogan from the University System of Maryland office. Those two will also be here to answer questions. Thank you very much.
Thank you. Are there any questions of this witness?
Yes, Madam Chair.
Yes, Senator Kramer.
Ms., is it pronounced Bachman?
Hoffman, just like cough, only with a B. Thank you.
Hoffman. So you mentioned that there's this meet and confer, and this is one of the important labor rights that these graduate assistants have, and that they do in fact have the opportunity, should they choose to bring a labor representative.
Yes. Mm-hmm.
Whether they do or they do not bring a labor representative and they have this meet and confer, what is the responsibility and the commitment from the university system after this meeting?
Well, I'm sure it would depend on the details of any one meeting, but each one of our universities would have the responsibility to first listen and discuss fully with the graduate students in the meet and confer and shared governance processes.
And what about after that, ma'am? I understand. My question to you is, after the fact, what is the responsibility of the university after they've had this conversation? What happens next? Is the university obligated to act? Let me cut to the chase.
I'm sure there would be some argument, if you will, over the word obligation, but I can tell you certainly that discussions over the several years, and Dr. Fetter may be able to give you examples during the meet and confer process, that several changes have been made over the years, including increases in stipends, changes in the way that the expectations of the graduate students are defined, and a signed contract between the mentor and the mentee.
So the bottom line is there is no obligation whatsoever on an individual basis for the university to get back to the graduate assistant who had this meet and confer where they shared their concerns, but there is absolutely no obligation for the university to address it or ever take it up again with that student. Is that an accurate assessment?
Senator, if I could, I would really like to ask Carolyn Skolnick if she might help me out here on the definition of obligation for or responsibility.
Thank you. No, that's fine. Ms. Skolnick and I are familiar with one another. You also mentioned that you believe giving these bargaining opportunities, and that's all it is, an opportunity, these students would work to their detriment. Do you believe you know better what's in their best interests rather than the students who are here who have brought to this committee a number of letters of support from across the spectrum of the university system saying they would like to at least have this opportunity, but you're saying that you know what's better for them. Is that what is, am I understanding that correctly? You know what's best for these graduate assistants, despite the fact they're here advocating for this potential opportunity, but you know what's best because you think it'll be to their detriment. Did I interpret that correctly?
Mr. Senator, I sincerely believe that there would be flexibility lost if in fact there were collective bargaining. I believe flexibility and direct interaction between these young professionals and the administrators are the best way to make these solutions.
So you know what's in their best interest. They just don't understand and appreciate what's good for them. Thank you for that. Thank you, Madam Chair.
Okay, thank you. We're going next to Patrick Hogan.
Madam Chair.
Sorry, I'm skipping Carolyn Skolnick. Let me do that.
Good afternoon, Madam Chair. I do not have a prepared statement. I'm here to support the statements of Dr. Boffman and Dr. Fetter and to answer questions that they may feel I could add additional information to.
Okay, are there any questions of Ms. Skolnick?
Madam Chair, I did have a question.
I'm
going to go back to Ms. Perky's testimony. I mean, is this standard operating procedure that there is a ban on any outside employment? I mean, the way she described her financial situation, you know, the inability, because she doesn't qualify for various subsidies under certain different, the inability to have any other employment or source of income seems, is that, you know, again.
There's a lot of variability from one university system to another. Let's ask Ms. Skolnick, who's here.
Yeah, Ms. Skolnick, could you, just on that, that's very specific issue then, Ms. Skolnick, yeah.
Well, and I'll also ask Dr. Fetter from College Park, but my understanding is that universities may have a rule that graduate assistants not have outside employment with the understanding that their primary goal or role is as a student. And this rule is also applicable to undergraduate students who work in some cases. So the idea is that the student would focus on their studies and their graduate work, and that the up to 20 hours per week that they might be working as a graduate assistant makes up a significant amount of time, and that outside employment would interfere with their ability to complete their professional responsibilities.
No, I mean, I understand that premise, but I when you hear a story like we just heard, I would imagine there should be some flexibility. If somebody, you don't want any of your graduate students to be destitute, and that's when we talk about flexibility and that type of thing, that's a bit surprising that there aren't some exceptions or some attempt to petition for some deviation from that policy. And that, like, okay, I'll leave it at that, Madam Chair. I did want to get that out there.
All right.
Madam Chair, if I could respond, I apologize if I'm speaking out of turn.
Wait a minute, who's that answer?
It's Liberty Deffenbaugh.
No, I can't go back.
That's okay.
But if you want to send us information, send us an email. We'll
Sure. Thank you.
All right. We're going to Patrick Hogan.
Thank you, Madam Chair. I'm also just joining in case there are any questions, but we do still have Steve Fetter on our panel who from College Park who has testimony to offer.
I didn't get to him yet. I see.
Thank you, Madam Chair. I'll wait and see if there are any questions and defer to Dr. Fetter.
You had nothing in particular, no special area of expertise that you need to share?
I do not, Madam Chair. I'm just.
All right, then we'll go to Stephen Fetter.
Thank you, Chair Kelly. I'm Steve Fetter, Dean of the Graduate School at the University of Maryland, College Park, where I oversee policy for graduate assistants. This responsibility rests with me because assistantships are part of a student's education. My job, my full-time job, is to ensure the success and improve the experience of all graduate students, and that includes their success and experiences as GAs. Being a GA is not like working in a dorm or a dining hall or driving a shuttle bus. Almost all PhD students are GAs, many for 5 or 6 years until they graduate. Research assistants are supported by a faculty grant, usually doing research for their dissertation, which is required for their degree. This research is required regardless of whether they have a GA. The power dynamics that Rachel Lim mentioned are real, but collective bargaining is not the solution. Collective bargaining can have no bearing on the amount or quality of work needed to demonstrate the ability to do original research, which is the standard for earning a PhD. That's why most universities with collective bargaining explicitly exclude research assistantships. Many programs expect or require students to serve as teaching assistants. This is part of the professional development of our future faculty. Even for those who won't go on to faculty positions, learning to explain complex concepts is essential for all researchers. You only really understand a subject when you can explain it to others. Given Chair Kelly's experience, I want to note that most TAs only teach one course and few are the instructor of record. University faculty understand what is required to be a PhD level researcher. We also understand the difficulties and challenges that can arise because we've all been there. As Dr. Boffman noted, we have a meet and confer process where students can raise concerns, and we have responded to those concerns. We've raised minimum stipends by 20% in the last 2.5 years. The average stipend is now $22,000 per year. Although that may not sound high, this is only for 20 hours per week for only 9 months per year, which is equivalent to $59,000 for full-time work. It also includes free tuition and the same health insurance available to me. Departments with external funding can pay more. Some pay over $30,000. Other departments would like to pay more but are unable to do so because of limited state budgets that were cut 7.5% this year. We've also addressed concerns about expectations and work hours, a grievance process, and leave. The bottom line is that GAs are our students, and we want our students to succeed. Thank you.
I'd just like to respond that I understand that the way our university systems are organized right now, it is economically advantageous both for you to use the graduate assistants to keep down costs for everybody across the board and for other lines in the budget other than even teaching. But we are in a more enlightened age than we were back in the medieval period. And the way we did things then it seems largely the way we're still trying to do things now. And people are asking for total dignity and respect. They do have to bring a significant amount of not only discipline, good time management, but knowledge of the subject matter that you have them sharing with undergraduates when they take these positions as teaching assistants, and they become an integral part of your teaching faculty. But we're still in the medieval period in terms of what remuneration and what degrees of freedom they have to get to speak up for themselves and to bargain for themselves.
Could I respond?
Yes.
So we don't use graduate assistants as teaching assistants because it's a cost-effective way to teach courses. In fact, it would be lower cost to hire professional track faculty or adjunct faculty to teach those courses. We offer graduate students the opportunity to teach because it's part of their education and professional development, and it helps support PhD students. It helps support their education overall. It's financial support for them to earn their degree. So our motivation is not primarily cost-effective teaching.
I'll tell you, I was a debate coach at Morgan, and West Point used to come to our debate tournaments. You guys are good at debating, but some of this doesn't hold water anymore, I think. But anyway, let's see. I think Mr. Fetter or Dr. Fetter, you were the last person.
Madam Chair.
Yes, Senator Kramer.
Thank you for that, Madam Chair. And once again, Madam Chair, I think you absolutely made the case for why we need to pass this legislation this session. But having said that, Dr. Fetter, what is it that you fear at the notion of graduate assistants having the opportunity, should they choose, to have representation by a bargaining unit? Why are you here telling us not to do it? What do you fear, sir?
I don't fear anything. I just want to point out certain disadvantages. So if collective bargaining leads to substantially higher stipends and our budget does not increase proportionately, that will lead us to be able to offer graduate assistantships to fewer students.
Dr. Fetter, can we pause right there? I want to address these one at a time. Do you have any empirical studies that would indicate that the assertion you just made is in fact accurate? There are universities across this country that have afforded this opportunity to their graduate assistants. Do you, sir, have any empirical documentation to validate the assertion you just made?
At one of our Big Ten peers, Rutgers, which has collective bargaining, the minimum stipend is over $30,000 per year. And there have been statements from student groups advocating for collective bargaining who have maintained that the minimum stipend should be as high as $36,000.
And do you know whether there was a control for Rutgers that includes all the variables that are affiliated with that particular university, that perhaps the stipend might reflect those variables? I am speculating that there are universities across this country that don't have collective bargaining that have higher stipends than the University of Maryland system. Would that be accurate?
Yes, for example, the University of Michigan has a slightly higher average stipend than we do.
So it could be that it may or may not have anything to do whatsoever with having collective bargaining opportunities, that Rutgers has a scale that's higher than the university system, which then goes back to my original question. Do you, sir, have any empirical studies or documents that would support your assertion? If so, I will ask you to provide them to me. And with that, Madam Chair, thank you. I appreciate the opportunity. Thank you, Dr. Fetter, and I appreciate your candid response.
Okay, Senator Benson has the last question, I think. You've got on mute.
Yes, Dr. Fetter, thank you very much. The other universities, the Big Ten, can you think of, are there any other universities that have collective bargaining for the graduate students?
Yes, I don't have a complete list, but in the Big Ten, 5 of the 14 public universities have collective bargaining.
Really? Except for the University of Maryland?
Well,
No, only 5 of 14 have collective bargaining.
Thank you.
Okay, thank you so much, and that ends the testimony on this bill. We're going next to Senate Bill 876, Senator Jackson. Senator, you have whatever time you need to discuss your bill, and then let's see. Okay, well, you didn't have live witnesses, so all right, we'll hear from you now, Senator Jackson.
Thank you, Madam Chair, Mr. Vice Chair, and I apologize of jumping in and out of your hearings today. We're in voting sessions in JPR.
We understand.
Yes, ma'am. For the record, Michael Jackson, Senator for District 27, on behalf of Senate Bill 876, Innkeepers, Records, and Human Trafficking Awareness Training. Senate Bill 876 is a piece of legislation that's drafted to help stop the spread of crime of human trafficking in our communities and to bring about an end to the suffering endured by its victims. This bill will do 2 things, Madam Chair. It will require the Governor's Office of Crime Control and Prevention, Youth, and Victim Services and the Maryland Department of Labor to develop an education training program offering guidance to employees of hotels and motels on ways to recognize the signs associated with human trafficking. Costs and effort associated with the development of such a program will be minimal, as both GOCAP, or Governor's Office of Crime Control, Prevention, Youth, and Victim Services, and the Maryland Department of Labor have indicated that a great deal of related materials have already been produced by the United States Department of Homeland Security. After the development of the program beginning in 2022, innkeepers would need to annually certify to the department the completion of said program by their employees. The bill would also, secondly, the bill would also require innkeepers to maintain a computerized record-keeping system of all guest receipts for a minimum of 6 months, obviously for law enforcement purposes and accountability. This feature of the bill would provide law enforcement officials a critical tool in tracking down perpetrators of these crimes. As you may be aware, my profession has led me to understand how vital it is for law enforcement and the business community, and in particular our community, to work together to recognize signs of such incidents in our community. Ensuring that law enforcement officers have the most useful tools at their disposal to stop the suffering endured by those victimized by human trafficking is a priority that I believe we can all get behind. I'm confident in this legislation. That's why I joined the original sponsor in the House, Delegate Eric Ebersol, in putting forth this legislation. So, Madam Chair, I would ask you and your committee for a favorable report of this bill, and I'd be happy to try to answer any questions you may have. In your packet, you should have some support documentation from those in the industry. Thank you very much.
Thank you. Are there questions for this witness? Senator Vital.
Thank you, Mr. Chair. Senator Jackson, thank you for the testimony. Have you seen the request for amendments that have come from 2 of the folks that are going to testify yet? Have they discussed those possible amendments with you?
Ma'am, thank you, Senator. I believe they discussed it with Delegate Ebersol. His hearing was, I think, a week ago. And so they contacted my office. We weren't sure whether they were going to show up today or not. But we are interested in any amendments that'll make this bill happen. I think, as we all know, human trafficking is a scourge that we need to certainly stamp out. And you'll see some further legislation coming forward regarding human trafficking, and this is just one step, one tool for us. So.
Thank you, Senator Jackson. I actually represent the area that includes BWI Airport, and I know that it is a problem in that region. So thank you for the
Okay, thank you. No questions for the sponsor. All right, we're going now to the other witnesses. James Stark from Best Western Arundel Mills.
Good afternoon, Madam Chairman. I'm Jim Stark. I'm the General Manager of the Best Western Plus BWI Arundel Mills, located in Howard County, but we service the area of BWI and Arundel Mills. And I just want to say that we absolutely support this bill. And I also want to say that I'm also the legislative co-chairman for the Maryland Hotel Lodging Association. So we've worked with Delegate Ebersol over in the House side on some of these amendments that we have a few more folks on the panel that are going to speak to those a little bit later on. And they're just really common sense amendments, nothing that's really earth shattering. But I just wanted to speak briefly about my hotel and the training that we do as a branded hotel. All of the major branded hotels a few years ago sort of came together on their own, realizing that this is such a huge problem, and came up with their own training. And it's the same training where they use the framework from the American Hotel and Lodging Association. So all of the major brands for years now have implemented training. It's training that has to happen within a certain short period of time from being hired, and recertification has to occur annually. Actually, January is National Human Traffic Awareness Month. So I know at my hotel, that's the month that we focus on retraining all of our existing staff. And we've actually worked with local law enforcement to allow them to conduct sting operations at our hotel to sort of sniff out some of this activity in Howard County and sort of just eradicate it if we can. And even 2 weeks ago, my staff recognized some suspicious activity, and that's exactly what was going on. And the Howard County folks responded immediately and snubbed it out and arrested the individuals that were involved. So the hotel community is sort of leading the way and recognizing that this is an issue, and we definitely want to be good Samaritans and do the right thing. As far as the amendments go, and this just speaks to the need to have the state sort of develop programs, we would just sort of suggest that the programs that exist on the national level and by the major brands, that those have been given careful thought and consideration, and those are in place right now. They're implemented. Our folks have that training. That training be accepted as part of this initiative. With that being said, thank you for your time and thank you for your consideration. We are absolutely in favor of this bill with hopefully these amendments that'll just help us keep operating with the training that we're used to. Thank you.
Thank you. Are there any questions of this witness? Okay, we're going next then to Ari Plant.
Good afternoon, Madam Chair, Mr. Vice Chair, members of the committee. Unfortunately, my video will not start. I think it's been disabled. Oh, there we go. Thank you very much. Good afternoon, Madam Chair, Mr. Vice Chair, members of the committee. I'm Ari Plout here from Boston Plout on behalf of the Maryland Hotel Lodging Association in support with amendments. You should have my written testimony. It's basically the written testimony are the amendments that we would like to see in this bill. And as Jim alluded to, the amendments are simple amendments, friendly amendments that just would bring the state up to what the hotels are already doing in their practice. And as Jim said, the industry, yes, we are very proactive in this, and we appreciate Senator Jackson for putting this bill in. So one amendment I did want to outline, though, is the 45 days that I put in on the last page. We would encourage the committee to adopt on that amendment for new trainees to require the 45 days before they upon hiring, before they would have to get the training. But with that, I'm here to answer any questions and hope you can adopt their amendments, and thank you for the time.
Just so we understand, whenever the committee is ready to vote on the legislation, what benefit does waiting the 45 days have, and for whom before they get the training?
Jim or Amy may be able to. Amy
Sure,
Roll.
I can speak to that. I think it goes in here at the majority of the major brands that window is actually a little bit less, but I do see the value in the 45 days due to the fact you might have people that you're hiring that are very part-time and they may not have, there's other training things that they have to go through in addition to the human trafficking. So if somebody is very part-time, you know, 1 day a week or 1 day every other week, it gives them an opportunity to eventually get to where that is on the chart of training. And no employee within the first 45 days is really ever on their own anyway. There's always shadowing and mentoring that goes on. So
Thank you. All right, Amy Rohrer.
Good afternoon, Madam Chair and members of the committee. For the record, my name is Amy Rohrer, here on behalf of the Maryland Hotel Lodging Association, with a position of favorable with amendments on Senate Bill 876. I can just add on to the testimony you've already heard, and would like to make you aware that we as an association are aligned in efforts with the American Hotel and Lodging Association in their national No Room for Trafficking campaign. And that campaign is all about steps that the industry can and should take to battle against human trafficking in our hotels. The campaign promotes steps that are in line with this bill, but actually go beyond the requirements as introduced. And as it has been mentioned, there are numerous human trafficking training programs already in existence. They were developed with input from the industry and from NGOs such as ECPAT and Polaris. There are many brands, not just gyms, but many brands that mandate and provide the training to their hotels. Also associations, including us, provide training to hotels. So it is widely available and these are good programs. The amendments that were submitted by our lobbyist, Ari Plout, are in front of you, and our intent with them is to ensure that reasonable initiatives that are already taking place at many hotels and promoted by the No Room for Trafficking campaign would be followed by all Maryland hotels. We think it's very important. I'd like to draw your attention to the more substantive amendments that are proposed for your consideration. Number 4 addresses the inclusion of more specific components in the training, such as the definition of human trafficking and commercial exploitation of children, differences between labor and sex trafficking that is specific to the hotel sector, and the role of hospitality employees in reporting and responding to this issue. The other amendments go beyond training. Amendment number 8 has to do with signage. We encourage hotels to have human trafficking awareness signage visible to their employees in the back of the house. And amendment number 9 addresses policies and procedures. It is so important for employees to know exactly how to report suspected human trafficking and for hotels to have prevention policies implemented for all of their employees. So at the end of the day, we view this as something that is simply the right thing for the industry to do. Human trafficking is a horrific crime, and we know it unfortunately occurs in every type of accommodation. And the more our employees have awareness and know how to respond and report it, the better chance we have of putting an end to it in our hotels. So I thank you for your consideration, and I'm happy to answer any questions.
Are there any questions of this witness? Well, I want to thank the sponsor and all of the witnesses. It's a very important issue, and we will take your testimony serious.
Thank you, Madam Chair.
Thank you so much.
Okay, we're going finally to Senate Bill 461, Vice Chair Senator Feldman. And Senator Feldman, you know the ropes, so.
Yes, I definitely know the ropes.
Limited time, okay.
Madam Chair and members of the committee, as you all know, we created some years ago, back in 2013, we did create our medical cannabis program, legal medical cannabis program here in the state of Maryland. And we continue to adjust our laws, to reflect what's happening on the ground, what's happening elsewhere in the country. And so what this bill specifically deals with is a very narrow bill dealing with workers' comp and our legal medical cannabis product in the state. And in effect, what we're trying to achieve here is parity in workers' comp for our medical cannabis patients. And a couple of years ago, Senator Zirkin actually introduced a bill, and I guess Senator Reedy would have been on JPR at the time. It was Senate Bill 859 in 2019. This very bill was included in Senator Zirkin's legislation in this space, and it actually passed the Senate unanimously. So you may want to look back. There were some other issues in the bill, not just this workers' comp topic, but most of you would have voted for this. There was a crossfire in the House at that time, and we ran out of time in 2019. So let me just say, this bill is not about relitigating whether you agree whether medical cannabis is a good idea, bad idea. We made that decision back in 2013. We're not going back. And the fact is that in the United States right now, there are 33 states that have medical cannabis programs. Most recently, Mississippi, at the November ballot, passed one of the more liberal programs in the country. This is not deep blue America. South Carolina's General Assembly right now looks like they're about to pass a medical cannabis program. And we have a full-blown commission that regulates the product. You have to be registered with the commission. We've got the requirement of certified providers and physicians that then make recommendations. And even last year, as we continue to update, if you recall, we passed a bill on a bipartisan basis, Connor's Courage, in this committee that would have allowed children in schools with severe health issues to access their medical cannabis treatments at the schools. And there was essentially no opposition to that legislation out of this committee last year that became the law of our state, signed by the governor. So it's really, we're talking about parity. So turning to this bill, Senate Bill 461, we know, this committee knows more than almost any other committee in the General Assembly, all the issues and problems surrounding opioid use, opioid addiction. So when it comes to pain relief, a lot of the folks who have pain relief for a variety of reasons do not want to go the opioid route. They just don't want to. They find that they can find their pain relief from the use of medical cannabis, and they would prefer to go that route as opposed to, again, opioids or other prescribed medications for pain relief. However, while opioids and other prescription medications are covered for workers' comp purposes, state legal medical cannabis is not. It's all out of pocket, and it can be significant out-of-pocket costs. So what's happened in recent years, several states have moved forward. Right now we're up to 6 that have moved to put the two on par, medical cannabis and then opioids, other prescription drugs. And those states right now are Connecticut, Maine, Minnesota, New Jersey, New Mexico, and I think most recently New York, which require insurers to pay workers' comp claims involving medical cannabis on workers' comp, in workers' comp cases, essentially reimbursing for workers' comp that are incurred for workers' comp purposes. Our own workers' comp commission recently, even though it's not in our law, what the bill calls for, even in our own workers' comp commission, 2 recent cases ordered the reimbursement for medical cannabis for certified medical cannabis patients. And there was, in fact, I think an appeal taken at some point. I think the circuit court in Carroll County affirmed those decisions from our workers' comp commissioners. So that's basically what this bill does very narrowly. It establishes parity between medical cannabis and prescription medication for workers' comp purposes. So the bill's very straightforward, really only has 2 provisions. Number 1, it adds medical cannabis to the list of substances that, if recommended, let me be clear, if recommended by a certified provider, is going to be included in compensation benefits for workers' comp purposes. And then number 2 clarifies that an injured employee may be denied compensation benefits if the cannabis was taken without written certification from a certified provider or physician. It is prospective in nature. It will only apply to claims going forward, nothing in the past. And there are some amendments. I will say that the Workers' Comp Commission did come up, and you'll see in their testimony some recommended technical amendments, which are I'm offering. And Chesapeake Insurance, which I'm going to get to in the morning, our largest workers' comp carrier, also have had some suggested amendments, which will be part of the amendment package that I submit. And so how it would work is if we pass this bill, the Workers' Comp Commission, like it does for everything else, would include in the regulations a fee guide schedule, again, as they do with all other medication. So in the past, Chesapeake, our largest workers' comp carrier, has always been opposed to this bill. And largely based on the fact that these programs, we're up to 33, 34 states, is still not in accord with federal law. And I'll close with a point about all that. But this year that's changed because they see what's happened around the country. This program is growing. It does afford pain relief for many Marylanders. And so they are not opposed this year. They're taking no position. So let me just take that. That's a major significant change from the past. Now, the national carrier, so there's 3 letters in your file, pushback from 3 players. And if I might, Madam Chair, quickly go through those 3 and I'll bring it to some closure. So the first are not Chesapeake, but the national players. So you'll see a letter from the American Property Casualty Insurance Association. So those are the national players. And if you look at their testimony, it's really pretty interesting. So the main argument they make, it's again, the generic, this is against federal law, therefore, et cetera. And they make a pretty startling statement. They go by requiring reimbursement. And by the way, one of the other amendments will be that we are not going to say that the carriers have to pay directly for these costs. It's a reimbursement. It will go to the patient. And I'll come back to that in a second. So that's another one of the amendments. But here's what they say. They say by requiring reimbursement for medical marijuana under workers' comp, the state would force the employer or insurance carrier to become an accomplice to a federal crime as identified in the Controlled Substance Act, okay? That's what they say in their opposition. Now, if you look at the Cannabis Commission's letter on this bill, they're favorable with amendment letter. They shoot that down very specifically. And if I could just read to the committee what the Workers' Comp Commission written testimony in front of the committee, it says, it is notable that although a majority of states have now legalized medical cannabis, there has been not a single federal prosecution for violations of the Controlled Substance Act against employers or insurers for the reimbursed for legal cannabis. So they make that statement. So it's a bit, nothing like this has happened anywhere in the United States, no prosecution. And the feds have made it very clear they are not involving themselves in state medical cannabis programs. And then they go even further to say that further workers' comp coverage for medical cannabis is not even in conflict with the Controlled Substance Act, since it does not involve the possession, manufacture, or distribution of cannabis. It only requires reimbursement for the cost. So if you look at the cannabis position paper, they completely discredit this statement that it's some kind of a conspiracy to commit a crime. Really, there's nothing that's happened in the United States or in any of the 33 states to support that. Secondly, MACO also favorable with amendment, and they have an amendment that they have proposed. They also make the point that it's illegal under federal law. If you look at MACO's testimony, and then they say being required to provide this as medicine under state law may jeopardize federal funding for local jurisdictions. Now, I would remind the committee that last year in the Connors Courage bill, that was exactly the same argument the school said. They said, we can't do this in our schools because we risk loss of federal funding. Again, there's no example to my knowledge anywhere in the United States where anybody has lost any federal funding for having 33, 34 states having these programs in place. Having said that, they do offer an amendment, and I'm going to take a look at it because they would like an amendment that would say, in effect, an amendment that language that would say that legislation wouldn't be applicable if doing so would violate federal law or cause the employer to lose any kind of monetary. So I'm going to take a look at that. I'm going to keep an open mind. I'd like to ponder that one a little bit. So that was MACO's testimony. And then finally, Madam Chair, the only other testimony pushback on the bill is from the chamber. And I'll be candid with you. I'm not even BSing here. I don't fully understand. I'm not sure if they're reading the bill. They say SB 461 seeks to prevent an employer or dependent from receiving workers' comp benefits if an injury or occupational disease was caused solely by the effect of medical cannabis. I mean, if you look at the chamber comment about what the bill does, if you look at the fiscal note, there's no mention of anything like that in the fiscal note. This bill is designed to say that if you, instead of going opioids and other medications, you want to use medical cannabis, you get reimbursed from the insurance carrier. That's all this bill does. So not certain I understand the chamber's position. They don't speak to that at all. The fiscal note doesn't mention this at all. And with all that said, Madam Chair, again, it's really a parity bill. This is a legal product in our state, as it is in 33, 34 states. 6 states so far have passed a bill like this. We ourselves in the Senate passed this bill 2 years ago. And with that, I'd ask for favorable with the amendments that I referenced earlier from the Workers' Comp Commission and from Chesapeake Insurance, which is not opposed to this bill this year. And I'll take any questions. We can go. I know we've got some witnesses
Okay,
behind.
is there anybody with questions for the sponsor? Senator Klossmeyer.
I know, Brian, I think maybe we talked about this a little bit last evening, but I really think this should go before the Oversight Committee, of which the Workers' Comp Oversight Committee, which it always has, and I think we need just to vet it a little bit more.
Kathy, I think that's good, but the committee hasn't met. So.
Well, guess what? It's going to. The committee's going to work. We're going to get together as a work group. Everybody, because I mean, all the people on the Workers' Comp Oversight Committee they don't even know what's going on. So I need to bring them in and let them know all the different bills. So I'm planning one of them in the next week.
Okay.
But your bill's fine, but I just think they need to hear it. So.
Okay, that's fair. I'm on that Oversight Committee, and I look forward to getting the email, for that meeting.
Yes, yes.
I'm hoping in December we would have had a meeting, but we did not. So.
No, we did not, but we were going to have one. And so the House doesn't want to have an oversight meeting, but I am having one because I feel it's necessary to hear not just on this bill, but all the different bills that are coming through as workers' comp.
Okay, fair enough.
We hope you can have it sometime next week, Madam Chair.
Yeah, I would like to do that. We'll just do it right on Zoom. I would prefer Zoom, but that's the way we have to do it. So okay.
We want to go to your 5-minute witness, Mr. Vice Chair, Kristen Megan, the Maryland Medical Cannabis Commission.
Good afternoon, Kelly, honorable committee members. Thank you for this opportunity to be heard. My name's Christy Magna, and I'm here on behalf of the Maryland Medical Cannabis Commission. The commission stands in strong support of Senate Bill 461. This bill is landmark legislation. With the authorized use of medical cannabis, it sparked debate about whether workers' compensation coverage should extend to medical cannabis patients and their treatment. Many states with medical cannabis programs, as Sponsor Feldman had discussed, do not have direct laws covering or not covering medical cannabis in workers' compensation cases. It says that the coverage extends to medicine for the covered employee, but doesn't clarify is cannabis. It doesn't specifically say before Sponsor Feldman's bill that the medicine includes medical cannabis. To legislate in this area would clarify the law. It would alleviate confusion and unneeded litigation and expenses. And in my opinion, most importantly, it would bring peace of mind to patients. As Senator Feldman said, there are a handful of states that are already doing this on a routine basis, and Sponsor Feldman also alluded to the recent Maryland case. And I would like to say that case was, it rightfully acknowledged medical cannabis for the medicine that it is. If you take out a dictionary and look at plain meaning of what medicine means, medicine is a drug, it's a compound, or it's a preparation that to prevent or in the prevention or treatment of disease. So clearly medical cannabis falls into the plain definition of medicine. Further, the reimbursement of the Maryland court comports with an already existing Maryland statute that says a Maryland medical cannabis patient cannot be subject to arrest, prosecution, a civil or an administrative penalty, or denied a privilege or right for their use of medical cannabis. The requirement for workers' compensation to include reimbursement for medical cannabis is being driven by the workers' compensation boards and court decisions. And it's only recently that states have gotten involved and started filing legislation to clarify and solidify this issue by codifying this requirement in statute. And there are at least 5 states that have pending or recent legislation very similar to Senate Bill 461. Senate Bill 461 represents an important advancement in creating equity under the law for medical cannabis patients. Parity in workers' compensation for coverage for medical cannabis, as it already exists for people who are prescribed pharmaceuticals, recognizes medical cannabis as the valued and important treatment for medical conditions. As Sponsor Feldman mentioned, across the code, we already have recognized parity between medical cannabis and prescription medications. And one of those examples was Sponsor Feldman's groundbreaking legislation with the Connors Courage Law. They're going to be helping so many students in our future. Another example of parity between medical cannabis and prescription medication is its exemption from the sales tax, state sales tax. And the theory behind that is that it's not fair to put a tax on someone's needed medicine. Workers' compensation coverage was created for humanitarian purposes. And in that spirit, medical cannabis can be an effective and humane treatment for chronic and severe pain. The Maryland Medical Cannabis Program currently has 127,000 certified patients. And a sizable number of those patients, approximately 50,000, have turned to our program for the treatment and management of their severe and chronic pain. Medical cannabis can serve as a less addictive alternative to opioids with fewer side effects and no risk of overdose death. According to the Centers for Disease Control and Prevention, there were more than 75,000 overdose fatalities in 2020. The opioid epidemic has been a modern day great American tragedy in healthcare for the lives lost and the lives harmed. Requiring workers' compensation coverage for medical cannabis in some cases could eliminate the need to instead cover high-priced prescription opioids, which may lead to addiction, overdose, and a cascade of other needed treatments such as surgeries. It is also important.
Ian, your testimony is very interesting, but we're going over time and we have to.
Certainly. Thank you for this opportunity. And I commend you, Senator Feldman, for your leadership in this area. Thank you.
Thank you. We're going next to Aaron Shepard.
Thank you, Madam Chair, and thank you for allowing me to testify. In 2002, I became in 2002, I began a number of knee procedures. One surgery led to another, which led to a total of 7 surgeries over a 4-year time frame. As you could imagine, these years of treatment, I was taking extreme amounts of opioids. My doctor was careless in treating me, and in the end, I was left addicted to the pills that I thought were helping. Not long after this, my doctor stopped prescribing, which led me to the streets to feed my addiction. In 2006, my life almost ended. One day I took too many pills and did not wake up for almost 14 hours. When I awoke, I knew I had to change everything. I tried detoxing cold turkey, but became very sick from the withdrawals. Because I knew it had to be safer, I decided to give cannabis a try to help my detox. Sure enough, this took away most of the sickness and was helping out with the knee pain that I still have to this day. January 8th of 2020, I started out early in the morning on my job. I am a low voltage technician and was wiring up a house that was under construction. Not long into the day, I took that dreadful step that resulted in a 10-foot fall directly onto my back. I was flown to Washington, D.C., where this journey began. I knew that this was going to require me to take medication for pain, which would be heavy opioids. With my addiction long behind me, it took several people to convince me that I had to take them, as I was laying there with a broken back. Because I was receiving benefits through workers' compensation, the only thing that was available to me under current policy was opioids. If you can imagine, I was absolutely terrified. Not only was I dealing with a life-altering injury, now I was once again faced with my past demons. I spent the entire year of 2020 at home recovering from my injuries, which included a surgery to fuse my spine together. Because of my history with opioids, thankfully, I had the knowledge to get off them as soon as I could. When I was able, I switched my pain management back over to medical cannabis, which is how I am treating my pain to this day. Unfortunately, because of the laws in place, this has put a huge burden on me financially. Although it may not help in my case, nobody should have to be put in this situation ever. Opioids do have their place, but I am living proof that medical cannabis has a larger place for long-term ailments. This bill, if passed, would be a great tool in fighting the opioid crisis, as most opioid addictions begin with injury. I am asking for a favorable response on this bill, as cannabis is deemed medicine in Maryland and can be used safely to help treat injured workers. Thank you.
Thank you. Okay. If there are no questions of this witness, we're going next to James McAllister, Maryland Association for Justice Major.
Yes, Madam Chair, Jim McAllister from the Maryland Association for Justice. I've been handling workers' compensation cases for claimants for over 35 years. This bill is not about whether or not it's a good idea or that there should be a legislative judgment that injured workers should be prescribed cannabis or not. Because the decision to prescribe cannabis or not, the legislative judgment was made a while back. The question is, will we empower treating doctors? And if the treating doctor in his or her exercise of professional judgment thinks this is a preferable tool to treat the injury, are we going to empower those doctors to prescribe the same type of medicine that every other doctor in Maryland can prescribe? And that's the big question. And the reason you need to know that there are lots of checks and balances on this is how workers' compensation claims are handled. When one of my clients wants medical treatment or a prescription, I make a request of the insurance company. This isn't like Blue Cross and Blue Shield, where you're just given a blank check to go out and put down a card and things automatically get paid for. Every doctor visit has to be separately authorized. Every prescription has to be separately authorized. Every refill has to be separately authorized. If the insurance company doesn't want to pay it or don't think they should pay it, they do what's called an independent medical exam. They hire a medical doctor who looks at everything and provides them with an opinion as to why it's not a good idea to do this. And then the carrier denies the request. So, and then it goes to a hearing. And at the hearing, the commissioner gets the report from the treating doctor that says, this is why I think this is in the patient's best interest. And they get the report from the insurance company doctor who says why it's not. And the commissioner makes an informed decision. That's important in this particular instance because It's a check and balance. This is not a blank check that you're going to get a prescription card for cannabis and for the rest of your life, you're going to get cannabis just because you got hurt on the job. Every refill will have to be approved. Number two, if you have an appetite disorder, it doesn't automatically somehow sweep that into your workers' compensation case because the insurance company doctor is going to call it what it is, not causally related. John Kelly, who I think is going to be testifying today, is the lawyer who took the case to Carroll County that fought for medical cannabis. So under the current system, some of the commissioners believe they're authorized to do medical cannabis and some don't. Is it fair to have somebody who's treating doctor thinks they should be prescribed medical cannabis subject to the luck of the draw? If you happen to get a commissioner who says, well, I don't know, it's illegal under federal law, or if it were in the Maryland code, I would do it. But since it's not, and it's something new, I'm not willing to authorize it, even though I think the treating doctor is right. So in other words, if that person hadn't been unlucky enough to be hurt on the job, they get their medical cannabis, but they're not getting it because the commissioner needs the instruction that this bill provides. So also what this bill does not do is license people being high on the job. Employers right now, because opioids can be prescribed under the current system, have employees that are being given drugs that affect their ability to work. So
I hate to butt in, but you're going over time.
Okay, so we ask a favorable approval for this bill because if it is not approved, what's going to happen is these patients are going to use their health insurance. They're going to spend their own out-of-pocket money, and the people that should be paying for the drugs the doctors want aren't going to be getting the drugs the doctors want. Thank you.
Thank you. Are there questions of this witness? Okay, we're going to Alexandra LaFree.
Okay, great. Good afternoon, Madam Chair and members of the committee. My name is Alex LaFree, and I'm a student at the University of Maryland Carey School of Law. I'm here today in support of Senate Bill 461, which should be enacted into law for 4 reasons. First, Maryland and 35 other states recognize that medical cannabis is a legitimate medication. However, in Maryland, workers' compensation is not required to reimburse for the costs associated with medical cannabis treatment. Employers and insurers should not be permitted to treat medical cannabis different from any other medication. Generally, workers' compensation cannot and does not deny coverage simply because of the type of medication involved. For example, insurers will not typically refuse to cover an employee's legal prescription of opioid medications simply because that medication is an opioid. That is exactly what insurers do now with legitimate medical cannabis treatment. Senate Bill 461 simply seeks to include medical cannabis as a treatment option compensable by workers' compensation. Second, providing workers' compensation coverage for medical cannabis patients improves the health and well-being of Maryland's workers. For example, research indicates that legalizing medical cannabis benefits employees and their families by reducing the total number of workplace fatalities. Third, Senate Bill 461 is narrowly tailored to protect employers and insurers from unreasonable claims and financial loss. Under this bill, an employer can still deny reimbursement if an employee's injury was caused by cannabis and the employee took cannabis without a certifying provider or failed to take in accordance with that provider's instructions. Also, requiring workers' compensation to provide coverage for the costs associated with medical cannabis is actually cost-effective. Research finds that states with medical cannabis programs saw a decline in workers' compensation claims, and when claims were brought, they were for shorter periods of time. Lastly, Maryland must enact Senate Bill 461 to clarify the law. Maryland workers need to know whether their medical cannabis medication is covered by workers' compensation. Maryland must not take a case-by-case approach as seen in other states because it creates confusion, leads to inequities, and fails to set clear expectations for workers. As such, Maryland should adopt Senate Bill 461 to secure the health, safety, and well-being of Maryland workers by allowing them to receive repayment for their use of illegal treatment. Thank you very much for your time.
Thank you. Are there questions of this witness? Okay, we're going to Kevin Marillet.
Good afternoon. Thank you, Madam Chair, Senator Feldman, and esteemed members of the Senate Finance Committee. My name is Kevin Marillet, and I am testifying today in favor of Senate Bill 461. I have a unique perspective on this issue because I am the owner of a multi-generational construction company in Calvert County, and I will complete a Master of Science degree from the University of Maryland in Medical Cannabis Science and Therapeutics in May. In addition, I hold an MBA. The state of Maryland has recognized cannabis as an essential medicine, and now it is time to adjust our state laws to meet this new reality. The ability for an injured worker to choose cannabinoid therapy over highly addicted drugs will be paramount in fighting our opioid addiction epidemic. In my studies, we have reviewed the negative effects that can arise from cannabis use from a pharmacokinetic as well as a pharmacological standpoint. And it is proven that cannabis is one of the least toxic drugs in existence. The issues surrounding this bill include the legalities of state law versus federal law. There is no violation of the Cole Memo priorities. There is no positive conflict between the Controlled Substance Act and this bill. Federalism and the 10th Amendment provide the power to this state to make legislation on exactly these types of things. And the anti-commandeering clause offers protections to our state from federal preemption. As an employer, I want my employees to be able to get back to work as fast as possible with as few side effects from medications. And what you see a lot of times on opioids is the workers' comp goes into now addiction control. As far as a cost factor, in 2013, access to medical cannabis saved our Medicare system $165.2 million in payments across only 17 states at that time in the district. Some of the medical considerations, studies show a 64% lower opioid use with chronic pain for people that use medical cannabis, a 25% lower annual overdose mortality rate in states with medical cannabis, better quality of life in patients suffering from chronic pain, fewer medication side effects, fewer medications used. 60% of all opioid deaths occur from legitimate prescriptions. And some CDC info. In 2017, 70,000 people died of a drug overdose, of which 47,000 were from opioids. According to NIDA, the National Institute on Drug Abuse, no adult has ever died from a cannabis overdose, while 130 Americans die daily from an opioid overdose. The federal government's inaction concerning cannabis should not cause Maryland not to act in the best interests of its citizens. For all the above mentioned reasons, I ask you for a favorable opinion on Senate Bill 461. Thank you very much.
Thank you. Are there questions of this witness? Okay, we're going next to John Drew. Wait a minute. Oh, I'm sorry, to Drew Javin. Okay, I'm getting tired.
I first would like to apologize. We have the snow plows outside, and of course they are right in front of the house. Thank you, Chair, Vice Chair, members of the committee. For the record, Drew Jabin on behalf of the Maryland Association of Counties, here in support of Senate Bill 461 with a clarifying amendment. As always, you have my written testimony and I will be brief. MACO does not raise concerns with the intent of the bill. We're simply here to suggest what we hope is a friendly amendment. We appreciate the sponsor's willingness to consider it. Counties are concerned that due to cannabis being illegal under federal law, being required to provide this as medicine under state law could jeopardize federal funding for local jurisdictions. As the sponsor mentioned, MACO does suggest adding language to the bill saying that this legislation is not applicable if doing so would violate federal law or regulations or cause the employer to lose a monetary or licensing related benefit under federal law or regulations. Pretty comparable language has been incorporated into similar legislation this year to ensure that these unwanted outcomes are avoided, and we encourage the same approach for this bill. So again, MACO's not here to weigh in on the policy. We just simply want to make sure that federal aid is not jeopardized, and we request a favorable report with an amendment on Senate Bill 461. Thank you.
Any questions of this witness? Okay, we're going next to Robert Enton. He's unfavorable.
Thank you very much, Madam Chairman. Robert Enton on behalf of the American Property Casualty Insurers Association. And you have our written testimony With all due respect to the sponsor, and he and I did have a conversation about this bill earlier this week, we are in opposition. I think, from my point of view as an attorney, I understand that Maryland and 33 other states have legalized medical marijuana. But I also understand that whether you elect to sell it, whether you elect to grow it, whether you elect to process it, is your individual decision to make. We don't require anybody to grow it. We don't require anybody to process it. We don't require anybody to possess it. But for the insurance industry, and I think perhaps for other industries as well, but clearly for the insurance industry, one of our primary, and maybe our primary concern about this is that regardless of what the states do under 8 USC Section 2, the aiding and abetting statute provides that whoever commits an offense against the United States or aids, abets, counsels, commands, induces, or procures its commission is punishable as a principle. That is the federal law. And the question is whether they have chosen to prosecute it or not prosecute it, just like you may not be comfortable dispensing it because it violates federal law. The insurance industry is not comfortable paying for it because we believe, with all due respect to the sponsor, that it does violate federal law. Now, the Supreme Court of New Jersey currently has a case under review to deal precisely with this point. The highest court in the state of Maine ruled that Maine's statute, which would have mandated coverage for this, was unconstitutional because it was a state law which required someone to violate a federal law. Now, obviously, if the federal law changes, we won't make this argument. But until it does change, our companies don't want to take the risk that something may change at the federal level and we may end up being prosecuted for knowingly having committed a crime. The Supreme Court has made it very, very clear, and I'll be happy to give this citation to committee staff, that, quote, when federal law forbids an action that state law requires, the state law is without effect, unquote. So, we think that with that, I'll wrap up, Madam Chairman, I'll close in 10 seconds. We think that at this time, it's just not appropriate to have a law which requires someone, whether you think it's going to be enforced or not, to violate a federal law. And for those reasons, Madam Chair, and once again, with all due respect to the Vice Chair, we would ask for an unfavorable report on this bill. Thank you.
Probably if nothing happens except that we keep hammering at the feds. I had my bill drawn that I've had repeatedly this year for years to pay for regulate air ambulance costs, which local Marylanders often find terrible bills for when they didn't ask for it. And by the time I had my bill drafted this year, the feds passed the law to regulate them. So they are wrong and they sometimes are slow, but I think it's important to keep showing what is reasonable and right and morally permissible. And then maybe they will eventually see the truth. Okay.
Madam Chair, can I ask a question or two of Mr. Enton?
Yeah.
Okay. So,
sure.
Bob, I have to say the sentence that you're concerned that your clients will be an accomplice in a federal crime. And as I mentioned earlier, the Cannabis Commission itself felt it necessary to weigh in. So we have 33 states that have programs. We have 6 states that have passed bills like this. And as the Cannabis Commission, not a single prosecution, even remotely like what you described, is even in the universe of possibility right now. In the prior administration, even more so now, the United States Department of Justice is not. So that is why how would you explain how our largest workers' comp carrier, Chesapeake, apparently doesn't share your view They're not in opposition to the bill. Are they not concerned about being an accomplice in a federal crime? I mean, do you have any kind of explanation for that? You don't have to answer that because I don't want you to.
I'd like to answer. Thank you, Mr. Vice Chairman, if I could. Let me make it very clear that Chesapeake is a fine and outstanding company and is a member of the American Property Casualty Insurers Association. However, the fact that they're not in opposition to it and their trade association is, I think, is where we are. I mean, they're not here to support the bill. And if they want to make the decision, or any employer wants to make the decision, you know what? I want a workers' compensation carrier that will pay for this. Then they're out there in the marketplace and they can find one. But to mandate that insurance companies violate federal law, we think is inappropriate. And I would, with all due respect, just because Chesapeake doesn't oppose it, their trade association does.
That's fair. And we can just even agree about, I think as the Cannabis Commission points out, they don't even believe it's a violation of federal law because it's not, we're talking about reimbursement. There's no possession involved here, but let's put that aside. Can I just ask you more a fundamental question? The cost of opioid addiction, I think one of the reasons states are moving this direction because opioid addictions is so costly to workers' comp carriers. The medical cannabis is, from a business standpoint, makes so much more sense. How do you respond just as a business matter? I mean, do you challenge that assumption, or do you think that's kind of not based in any kind of economics?
So let me say this, Senator. You know, I represent a number of trade associations, and our trade associations, we don't take these positions just on our own. We, you know, reach out to our members, whether it's the bankers or the landlords or the insurance companies, and get, you know, see what our members think about it. And our members continue to be concerned about the fact that they would be mandated to pay for something that's a violation of federal law. That's the bottom line.
Okay, well, we could just leave it at that, but nothing to this date in the states that passed this bill. There's no indication, to your knowledge, of the United States Department of Justice coming after anybody.
That's
to your knowledge.
No, absolutely. I have no knowledge that they've prosecuted any insurance companies.
I'll leave it at that, Madam Chair.
Okay, we're going to Nancy Egan. Nancy, you're on, if you could unmute.
Thank you. Sorry, I had to hit the unmute button. Good afternoon, Chair Kelly, Vice Chair Feldman, and the other members of the Senate Finance Committee. My name is Nancy Egan. I represent the American Property Casualty Insurance Association, and as my colleague Bob Etten referred to, we write 86% of the workman's comp market in Maryland, so we are a large presence and we are opposed to the bill. Bob Etten spoke to the one thing that we're concerned about, which is the federal law. Our other concern is the lack of a sufficient objective medical evidence of its efficacy in treating workplace injuries. When these medical marijuana laws were put into place, the laws were drafted so neither us, the workman's comp carrier, nor health insurers are required to pay for medical marijuana. It's left to the different carriers to determine if that's in their best interest. In addition, doctors cannot prescribe marijuana. They simply recommend its use, and the physicians do not recommend the specific products, the ratios, the dosing, or the dosing schedule. One of the main goals of workman's comp is to achieve workplace safety, and in order to safeguard that, the efficacy of all modalities of medical treatment must be borne out by scientific, objective evidence. If in the future we have evidence that medical marijuana is a valuable treatment of such injuries, we would obviously regularly adopt that. And so let's go over that. Over the past year, COVID-19 has prompted a national dialogue regarding the importance of scientific, valid, and well-controlled clinical trials to demonstrate the safety and efficacy of a medicine. Products intended for cannabis use, including cannabis products, should be held to the same scientific and medical rigor. Cannabis products sold in dispensaries are currently not the case. They have not been demonstrated safe and effective in well-controlled clinical trials the FDA requires for other medicines. As a result, there's not sufficient evidence to permit conclusions that products lead to improve net outcomes. The FDA approval process provides critical information about a drug and the disease it seeks to treat, absolute safety considerations unique to patients who will take the drug, and rigorous process which answers important questions about whether a product is safe and effective for all its intended use. Does it work? How well does it work? What is the dose? What are the adverse effects? Are there potential drug-drug interactions? Are there potential drug-disease interactions? These are all things that we need to look at and have clinical trials to discover. In addition, we also are concerned about—
Okay, you're going over time.
Just 2 points. Number one, we are concerned about the fact there's also no standard for driving under the influence or operating machinery while taking marijuana, while there is one for for alcohol. So we cannot determine when someone's on the workplace, the influence. And one more thing.
Well, you know what, you're not gonna get the one more thing in. Did you also send us written?
Yes, I did. And I just wanted to say that if the federal government approves medical marijuana and does the test, we would be fully
We
supportive of it.
understand.
Thank you.
Okay, Andrew Kirkner.
Thank you, Madam Chairman. Andrew Kirkner on behalf of the National Association of Mutual Insurance Companies. I'm going to take my lead and make this very short. We would echo the concerns relating to the illegality of marijuana under Schedule 1 of federal law. Certainly respect and appreciate and agree with the Vice Chair that there have been no prosecutions of insurance companies under that. I would simply say that there could be tomorrow. And I think that is unlikely, certainly, Mr. Vice Chair, but it remains the fact, it remains federal law. And I would just make one slight correction to one of the earlier testimonies. Federal preemption would not give the state of Maryland the right to overrule federal law. Certainly, I think the argument can be made that the federal government is not enforcing federal law in this area, but it certainly would not give the state the authority. Though I would agree with the chair that the federal government is often wrong. So I see that point as well. The only other substantive point I'd like to raise to the committee's attention, which I think Ms. Egan was hitting on at the end of her testimony, is about returns to work. Workers' compensation insurance is intended to cover workplace injuries. And so obviously one of the things that we all share, I think, is a desire for injured workers to return to work, to be able to return to work. Based on the lack of standards, I think testing specifically in the cannabis area, oftentimes the use of medical cannabis in workers' compensation space can in fact delay that return to work, I think based on the levels of THC and the ability to determine that. So with that, Madam Chair, we'd ask for an unfavorable report. Be happy to answer any questions.
Madam Chair, could I ask one question, Mr. Kirkner?
Sure.
On this point, because I heard that earlier, but I mean, people go out and get addicted to opioids. I mean, this doesn't alter any of that. I mean, the employer has every right to test or do whatever for impairment. I mean, I don't understand exactly why you're picking on the workplace and somebody being impaired. That's now.
So, Senator,
you're subject and you get opioid addicted and you show up at the workplace. I don't understand how this is any different. That we have a whole body of law dealing with all this stuff. Any event.
Senator, I would just respond by saying I think the testing would be the central point here. I fully agree with your comments earlier related to opioid addiction and the impact that has had. This very well may be a good alternative. Unfortunately, it is illegal under federal law. The testing comment that I made, though, specifically relates to the longevity of THC in your system versus what some of those opioids might stay in your system. So returning to work, that testing that takes place, this may further delay that.
Okay, fair enough. Thank you, Madam Chair.
Okay, well, this ends our testimony and our hearing for today. And everybody be careful when you go out this afternoon. And colleagues, I'll see you